sir. One second. ಅದು ಸ್ಕ್ರೀನ್ ಶೇರ್ ಆಗ್ತಿಲ್ಲ ಸರ್, ಒಂದು ಸೆಕೆಂಡ್ ನಾನು ಮಾಡ್ತೇನೆ. ಹಾಂ ಸರ್, ಓಕೆ. Is it okay, sir? Okay, sir. I'm ready, sir. Hello, sir.
Yes, I hope everybody has joined. Shall we start? Okay. So, good evening, all. Today we have gathered here in this platform for the online paper presentation on behalf of Punarvasu, National Seminar on Ayurveda, Cosmetology and Trichology, to be held on 1st September 2024 in Davanagere, organized by Aptas Ayurveda Trust in association with World Ayurveda Foundation. Today's session is the first online presentation of Punarvasu seminar and first among UG presentations. On this occasion, I, Dr. K. Kiran, I wholeheartedly welcome you all for today's program on behalf of Aptas Ayurveda Trust.
Thank you.
Today we have two esteemed guests as judges for today's session. We have Dr. Arun Kumar sir from Brahmavar, Udupi. Sir has let me give a brief introduction about our guests, and later we will proceed with the presentation. So, Dr. Arun Kumar sir has completed his BMS from SDM College of Ayurveda, Udupi, and MD in Roga Nidana from JMC Bangalore. Sir has academic experience of more than 10 years. Sir has several publications in renowned journals, and he's also involved in various research projects. And Sir also has given various TV and radio and public talks and been a resource person in several Ayurveda programs, and also been a member of National Syllabus Committee of Roga Nidana, CCIM. Sir is presently working in SDM College of Ayurveda, Udupi as Associate Professor in the Department of Roga Nidana. We are very happy to have you today with us as our judge, sir. A warm welcome to you on behalf of Aptas Ayurveda Trust. Welcome, sir. We also have one more guest as judge, that is Dr. K. Manaram S.P. Pereira from Maratua, Sri Lanka. Sir has finished his undergraduation in Sri Lanka and MD Agada Tantra from SDM College of Ayurveda, Hassan, Sir has worked as demonstrator in Institute of Indigenous Medicine, University of Colombo, Sri Lanka, and worked as community medical officer in Ayurveda Community Medical Service, Anuradhapura. At present, Sir is working as medical officer at Bandaranaike Memorial Ayurveda Research Institute, Navinna, Maharagama, Sri Lanka. Sir has a vast experience in the field of community medicine, toxicology, cosmetology, treatment of chronic kidney diseases, geriatrics, and palliative care. Sir has several publications in his name in peer-reviewed journals, especially related to cosmetology in Ayurveda. So we are delighted to have you here with us today, sir. A warm welcome to you on behalf of Avtas Ayurveda Trust. Welcome, sir. Welcome you, sir. I also welcome Dr. Sneha C. Shekhar, moderator of today's session. Welcome, Dr. Sneha. So, with this brief introduction, let us move on to begin with the presentation. So, I request Dr. Sneha to take over and proceed with the presentations. And I wish all the presenters all the best. So over to you, Dr. Sneha.
Thank you. Namaste, everyone. Respected chairperson and organizers in this seminar. I am Yashash Chakravarti, studying in second professional BMS from STM Ayurveda College, Udupi. See, the world is going crazy about the beauty, and there are a lot of things about the beauty in which there is a discussion going on. Now, I am here to unfold the interesting information about the beauty in Ayurveda and other fields under the heading of the why and the how of beauty. See, in the first slide, Rupa. What is Rupa? According to Prashastapada, Rupa is censored through the visual sense faculty. It is residing in three substances, Prithvi, Udaka, and Agni. In the Karya Dravya, Rupa is dictated by the color, color of Karana. We can take the example like Anjana. The collyrium being black in color, when applied to the eyes, all the three colors, man, one second. There is a network issue. One second, I will correct. One second. Okay. Ah, okay. It can. Is it okay? Okay. I can start from the beginning. If you okay. Okay. Namaste everyone. Respected chairperson and the organizers of this seminar. I am Yashas Chakravarti, studying second professional BMS from STM Ayurveda College, Udupi. See, the world is going crazy about the beauty, and there are a lot of things about beauty in which there is a discussion going on. Now, I am here to unfold the interesting information about the beauty under the heading of the why and the how of beauty. See, in the first slide, Rupa. What is Rupa? According to Prashastapada, Rupa is sensed through the visual sense faculty. It is residing in three substances, namely Prithvi, Udaka, and Agni. In the Karya Dravya, Rupa is dictated by the color of a Karna. We can take the example like Anjana. The Anjana being black in color, when applied to the eyes, all the three color parts will become well defined, clean, and beautiful. Now, these statements raise deep questions like why do certain configurations and the color and the form exist us? And there is another question like what is beauty? Decision there are few basic parameters for the attractiveness or beauty. When it comes to seeing beauty, the decision is certainly subjective. Means for the individual, it is personal. They can see however they want. It is ugly side, it is a beautiful side. It's their choice. And it is sculpted by the factors that contribute the survival of the group, like buddhi, which is karmanusarini. There are, I told so, there are few basic parameters that contribute which makes the face attractive. There are three factors: average, symmetry, and hormones. Let's take each one in their turn. First one, average. Average faces represent the central tendencies of the group. People with mixed features represent greater genetic diversity. Many people find mixed race individuals attractive and inbreed families less so. Regarding this, we find Atula Gotriya and Prakriti as a reference in our Shastra, and where Kapha Prakriti individuals are Prasanna Darshanana. There is a reference in our Samhita. Next, next factor we can see this is the averaging, and next factor we can see symmetry. Symmetric faces Symmetric faces that the second factor that contributes to symmetry, beauty is symmetry. People generally find symmetric faces more attractive than asymmetric ones. There is a development abnormality are often associated with the asymmetries. In the in the humans, asymmetries are often associated with the parasitic infections. We can take the example like kushta, and the development abnormalities like skandagraha. Now move on to the third factor, hormones. The third factor that contribute to the facial attractiveness is the effect of hormones. Those are estrogen and testosterone. These hormones play an important role in the shaping features that signal that signals that signals and the people find attractive who have elements of both youth and maturity. Now, what happens in the brain when we see beautiful people? There is a question, and there is an answer to that also. Attractive faces activates the part of our visual cortex in the brain, an area called fusiform gyrus. A anatomical area. There is an anatomical area called fusiform gyrus, where that is specially tuned for the processing faces. In the lateral occipital complex, especially it is attuned to the processing objects. The fusiform gyrus is for the faces, and the objects is controlled by the lateral occipital complex. In addition, in addition, activates parts of our reward and there is a areas called reward and pleasure cortexes, like ventral stratum and the orbitocentral cortex. Our brain, that is tuned up to processing phases, interact our pressure centers to underpin the experience of the beauty. Now, there is a doubt. I told you so. There is a doubt. Beauty. Some people take beauty as a good. Beauty as a ugly side, like that. Here, beauty is a good stereotype embedded in the brain. Okay. Let's see. The beauty is a good. That side. Within the orbitofrontal cortex, there is a overlapping activity reflexively associated with the good. Maybe a good. Maybe the biological trigger for many social life attractiveness. Beauty as the ugly side, we can see like we also have a disfigured is bad stereotype in which the facial disfigurement is often used as a shorthanded to depict someone for village characters, and we exploit by looking into the social media. Beauty is like that. They are like that, like that. This is the beauty's ugly face. Next, I need to inform you one final thought, that is, beauty is a work in progress. While we all engage with beauty, without the knowledge, beauty also engages us. Understand this. While we all engage with beauty, without
So, Yashas, your time is done. Now, the second presentation would be by Virupakshi from Sushruta Institute of Ayurveda Medical Science and Research Center, Davangere. And her presentation would be on topic Keshapraksha, the hair care. ಹೌದಾ ನಂಗೆ ಗೊತ್ತಿಲ್ಲ ನಂಗೆ ಹೇಳೇ ಇಲ್ಲ ನಮ್ಗೆ ಲಾಸ್ಟ್ ಥರ ಹೇಳಕ್ಕೆ ಇಲ್ಲ
ಇಲ್ಲಿ ಅಲ್ಲಿ ಪ್ಲೇ ಆಗಂತಲ್ಲ. ಗುಡ್ ಈವ್ನಿಂಗ್ ಮ್ಯಾಮ್. ಇಲ್ಲಿ ಇಲ್ಲ ಆಗತ್ತದ. ವೇಟ್ ಅವ್ರಿಗೆ ಕಾಣಿಸ್ತಾ ಇರುತ್ತೋ ಅವ್ರಿಗೆ ಕಾಣಿಸ್ತಾ. Hello, ma'am. Good evening, ma'am. Hello.
Yes, you are audible. You can continue with the presentation.
Ma'am, presentation is visible, ma'am.
Visible ಇದೆ. Presentation ನ start ಮಾಡಬಹುದು.
Okay, ma'am. Om Shri Guru Bhyo Namah. Good evening to my all delegated lecturers and my friends. Myself, Virupakshi, Sushruta Institute of Ayurveda Medical College, Davangere. I taken guidance by Dr. Chinmay L. Chigiteri, Assistant Professor of Samhita Dhyana. Yogasana and pranayama, it is a very unique concept in Ayurveda. I taken a topic under the trichology. The topic is Keshapraksha. Keshapraksha. The Kesha means the hair. The Praksha means the nourishment. How to nourish the hair by doing Yogasana and pranayama. It is a major topic I taken in here in trichology. By doing Yogasana and pranayama, how to do hair growth. Objectives: improve the blood circulation to the scalp. The blood is a very important thing to grow the healthy and strong hair. Uh, the blood is required to the scalp. It is by doing the yogasana and pranayama, and by doing yogasana and pranayama, the blood is supplied to the brain and scalp. It will helps to stronger the hair roots, and it will promotes the hair growth also. Nowadays, the stress is very important cause for every diseases. By doing yogasana and pranayama, it is helps to relax the stress and anxiety. When the stress and anxiety is decreases, the peace and the calmness created in the brain, it helps to easily production of hair growth. Methodology: the yogasana and pranayama, it is a very important procedure to growing of hairs. For that yogasana and pranayama, the methodology is very important. Methodology, the preparation. First of all, to find the comfortable space to doing yogasana and pranayama, set a regular time, take a good yoga mat. It is supported to easily to do the yogasana and pranayama, and wear the comfortable clothes. It is help to easily flexible of any movements and breathness also. When doing pranayama and yogasana, the before that doing pranayama yogasana, the empty stomach will be very important. I taken some yogasana and pranayama here to increases the hair growth. First one, Shirsasana, headstand, which will increases the blood flow to the scalp. And the second one, Viparita Karani, it is a leg up the wall pose. It will stimulate the blood flow to the scalp. It helps to reduce the hair losses and promote the hair growth. And Adho Shvasanasana. Adho Shvanasana, downward facing dog. It is also very important yogasana. It will increases the hair growth. Uttanasana, forward fold. It will stimulate the blood flow to the scalp, helps to reduce the hair losses and promoting the hair growth. And another thing, many yogasana is there for explaining how to grow the hairs. Bhujangasana, cobra pose, it improves the blood circulation and promotes the hair growth. Sarvangasana, it is the king of asana. It is easily flow of blood to the scalp and it helps to promote the hair growth. And many pranayamas are helps to growth good hair and flexible and healthy hair. Kapalabhati and Bastrika, the movement of air reaches from Nabi to Mastishka, vice versa, will improve the brain capacity and promote the good healthy hair. Bastrika. And many pranayamas is there. The normal first one is Anulomana, Vilomana. For pranayama, the first three stages are important: Puraka, Kumbhaka, Rechaka. The first one and the Puraka, Kumbhaka, Rechaka is three concept is very important in pranayama. It will help to flow of blood to the scalp. It will help to the hair growth. And Nadi Shodhana pranayama, nerve purifying breath. Maintenance of healthy of brain, it promotes the healthy hair growth. The brain, for brain, the blood is very important to the hair growth. And observation, I taken some observation from those who are practicing yogasana and pranayama. They told that the hair will be the growth rate is increases, and the hair density also increased, and the structure and the bulkiness also hair is increased by doing yogasana and pranayamas, and also reducing dandruff or itching also. Acharya Shushruta is classified Vata, Pitta, Kapha and Rakta of Keshas. By doing yogasana, it will helps to reduce the hair falls and dandruff, and it will promote the hair growth also. and many asanas and pranayamas is very important. Very important to hair growth. Nowadays, very stress and something is under the society. The for that relaxation of mind and physical and mentally strongness, yogasana and pranayama is very important. The regular practice of yogasana and pranayama, it maintains the scalp health and promote the healthy hair growth. For not only medicine is used for the healthy growth, pranayama, yogasana, and the sleep quality, the required amount of hours, the 7 to 8 hours of sleep quality, and cold shower, it is a very important things. It is a silly things, but also it is very important to the hair growth and regular and maintaining some balanced rate. It is also important for the.
Thank you, Virupakshi. Your time is done. And now I request judges to please ask questions to Virupaksh related to his presentation.
Namaste, Dr. Arun here. Hello, am I audible?
Yes, sir, you're audible.
Thank you.
Yes.
Kalesh, very good presentation and good compilation. Right. Can you further elaborate what is the benefit of improving the circulation to the scalp?
Virupaksh, please unmute yourself and answer to the judges.
Hello, sir.
Virupaksh,
Sir,
shall I
audible?
okay, shall I need to repeat the question?
Yes, sir.
Okay, you have mentioned that with the yogasana there will be improvement of blood circulation to the scalp.
Yes, sir.
What is the benefit of improving the blood circulation to the scalp?
Sir, it will helps to promote the hair growth and decreases the dandruff and itching also. Sir, so the respiratory system and circulatory system, it will helps to the flowing of blood to the scalps. Thus, for scalp, the good and pure hair, pure blood is very important for the hair growth and relaxation of mind. And the doing some of pranayamas, it will helps to hair growth, sir.
Okay, Kalesh, good attempt. Thank you.
Thanks.
Thank you, judges, and thank you, Virupaksh. Moving on to the third presentation, Vijay Lakshmi Dodmani from Sushruta Institute of Ayurveda Medical Science and Research Center, and her title of presentation would be Dantadhavana. Over to you, Vijay Lakshmi.
Yes, ma'am. Good evening, everyone. My topic is Dantadhavana. I am Vijayalakshmi from Sushruta Ayurvedic College, first year BMA. Introduction. Ayurveda is a medical science which is emphasizes the preventive medicine than curative.
Vijay Lakshmi?
Yes, ma'am.
Sorry to disturb. Can you enlarge your screen because it is very minimally visible?
Okay.
Yes.
Now, ma'am.
Yes, you can carry on.
Okay. Introduction. Ayurveda is the medical science which mainly emphasizes the preventive medicine than the curative. Dantadhavana is the one of the procedure in the Dinacharya. The Acharyas are told about the Dantadhavana in the Dinacharya. It maintains the oral hygiene. The Acharya Charaka explained the various benefits of the Dantadhavana, like the cleaning of the mouth and the destroy bad breath, clean the normalcy of the gum, keep the normalcy of the gum, and the increased taste sensation. And the Acharya Vagbata and Charaka tell about the twigs, which are the twigs to be used in the Dantadhavana and the features of the twigs and the methodology of the Dantadhavana. The drugs are the twigs used in the Dantadhavana arka, which is in Vatahara in nature, Negroda, which is Kapha Pittahara in nature, Kadira is the Kapha Vatahara in nature, Karanja is also the Kapha Vatahara, and Kakuba is the Ranahara, Karavira is the Kapha Vatahara in nature. Then the features of the twigs are the twigs should have the 12 inches of the length and the circumference of the little finger should be the straight and divide of nodes, uh, and it is collected from the sacred places. Due to the in sacred places, the twigs are available cleanly, and the twigs having the katu, tikta, and kashaya rasas, they are good for the brushing. Due to their antibacterial or the antiseptic action, and the paste or powder for the dantadana, which is used in dantadana by taking trikatu or trifala or trinjaka by mixing these powders with the honey, and methodology of the dantadavana. Tip of the medical stick or the twig, we have to crush and take a paste with it, and rubbing the teeth without causing any injury to the gums. And Acharya Charaka and Sushruta mentioned about the tongue cleaner. That is, after the brushing, we have to clean our tongue, and one should have to brush in a twice in a day, in the early morning and as well as immediately after having the food in the night. Then advantages of the Dantadhavana in the cosmetology. Cosmetology is the study and application of the beauty treatments, including the skin care, hair care, and the oral care. In oral care, Dantadhavana, it helps in the oral aesthetic, fresh breath, gum health, and teeth whitening, and it prevents from staining and discoloration of the teeth, enhances the professionalism, and supports cosmetic treatments, and promotes holistic beauty and enhance facial harmony and boost confidence. The Dantadhavana helps in these processes, and by it gives the confidence to being a healthy in the society. In conclusion, Dantadhavana is essential in cosmetology. It enhancing the facial beauty and supporting the cosmetic treatment. By incorporating the Dantadhavana in the daily routines, we can enjoy a healthy and beautiful smile and the overall well-being, and we can lead a overall healthy being. And thank you.
Thank you, Vijay Lakshmi.
Thank you.
Over to you, judges, for any questions or queries.
Thank you. Vijay Lakshmi, good
Sir.
presentation.
Yes, sir.
You
Thank you, sir.
have throughout the presentation mentioned that practicing Dantadhavana has significant health benefits,
Yes,
isn't
sir.
it? Can you say some drawbacks when applied in the current time?
Can you repeat the question, sir? I didn't understand that.
Dantadhavana is a very classical
Ah,
method which is mentioned in Ayurveda, no?
yeah, yes, sir.
To practice that in a current time, what are the some drawbacks?
Okay. I don't know, sir.
For example, can we get the sufficient sticks if we want to market it?
No, sir. Nowadays it is not possible.
Then when we get a stick, can we get a consistent quality?
Maybe, sir.
So there are certain drawbacks. If you overcome of that, definitely this is a wonderful tool at present time, isn't it? Okay. Thank you, ma.
Thank you, sir.
Hello, Vijay Lakshmi.
Hello, sir.
Hello,
Sir.
Vijay Lakshmi. Congratulations for your presentation. I have a small question. Hello. Why you have taken the Rasaguna Veera Vipakas for your presentation? You have mentioned the Rasaguna Veera Vipakas and karmas. That is Vatahara, Kapahara, and all.
Yes, sir.
This plants we are using for Dantadhavana only. Can it be the karmas like Vatahara, Kapahara? Can it be effect? Because we are not taking inside. How it affects? Can you give explanation?
Sir. Vatara, it is by inside it strongs the gums, sir.
Okay, you are telling that local action is also there, no?
Yes,
Not
sir.
the systemic. Okay. That's all. Okay.
Thank you, sir.
Thank you, judges, and thank you, Vijay Lakshmi. Moving on to the next presentation. The fourth presentation will be by Khushi MK from Sharada Ayurveda Medical College, Mangaluru, and her title of presentation is on Therapeutic Management of Mukhadushika, Acne Vulgaris, a review. Over to you, Khushi.
Namaste everyone. Ma'am, am I audible?
Yes, Khushi, you're audible. You can carry on.
Okay. So namaste everyone. Myself Kushi MK. I'm a final year BMS student studying in Sharada Ayurveda Medical College, Mangalore. I'm guided by my respected professor, Dr. Tony Thomas, from the Department of Chikitsa. This evening, I'm going to present therapeutic management of mukhadushika. My presentation is a review from various research articles. As we all know, physical appearance have impacts on our mental health. Acne vulgaris is an acute or chronic inflammatory disease suffered by many young adults ranging from 12 years to 30 years old. On a correlation in our classics, Acharya Sushruta has documented Mukhadushika separately among 44 Shudra Rogas, where he mentions Pitta is located in the skin and leads to manifestation of Pidaka. The simile which he gives is eruption in Mukhadushika looks like Kantaka of Shalmali plant. The doshas involved according to him is Kapha, Vata and Rakta. To explain my review, I have collected materials from classical Ayurvedic text, early research works, theses, publications and review articles. My objective would be to evaluate efficiency of Pralepa in Mukhadushika, Virechana and Jalakavacharana in Mukhadushika. As we all know, the Ayurvedic treatment is conducted in two ways, that is Shamana and Shodhana. In Shamana Prayoga, I would like to discuss about Lepa. Lepas are known for their Ropana, Varnya effect on the skin. They are convenient to the patients to apply by themselves in respective places. For example, I have mentioned few lepas on the slide. They are Siddhartha Kadi lepa, Panchavalkala, Manjishtadi, Vachadi lepa, Dhanya Kadi, Ailadi lepa. So the courses of these lepa on average last for 15 to 30 days. These are the few gunas of lepa which help in bringing back the normalcy of the skin. They are pitta shamaka, it should be shita virya, ropana, and varnya. Next would be shodhana karma. Virechana plays an important role in eliminating vitiated doshas from the body because it is a pitta pradhana and rakta pradhana disease with a little amount of kapha involved in it. So Virechana also helps in preventing the mukhadushika and as well promote the promotive benefits in overall aspects. Uh, Normally, Virechana is conducted after a snehana karma, which is classical Virechana. But if classical Virechana is not possible, patient is also advised to do Nitya Virechana. A simple practice would be taking Avipattikara Churna in a glass of warm water before sleep, or various kalpas like Eranda Taila or Trivrit Leha, Aragbadakwata, etc. Basically, any dravya which do anulomana can be used. So, Virechana along with Lepa holds better results. Next, another unique Shodhana would be Rakta Mokshana by using Jalokavacharana. So, as we know in Mukhadushika, what happens is these vitiated doshas they get accumulated in Lomakupa. So, Jalauka have hydrodine, hyaluronidase, histamines, which contain anticoagulant, anti-inflammatory, and vasodilators, antioxidant, antibacterial, all these in their saliva. So ultimately, what they do is they nourish our skin. What Jalakavacharana promotes is we know it acts on the surface of skin and suck out the doshas, clearing the roots of pustules and cysts, which leads to Sroto Shodhana and results in decrease in Kapha dosha and also decreases in Kandu. So further leads to anulomana of pooled blood and relieves pain causing due to vata. Later, what happens is Brajaka Pitta, which is present in the skin, imparts normal skin color and enhances the overall complexion of the skin. So the role of Jalapacharana would be 4 sittings with a 21 days gap, 21 days with a gap of 7 days between 2 sittings. So through the following procedure, I would like to say Jalakavacharana estimated result would be within 2 to 3 days just by one sitting, and Virechana by 2 weeks, Pralepa by 25 to 30 days. Hereby, I would like to conclude my presentation by saying Jalaukavacharana plays important role in visible reduction of pustules, relief from pain, quick results observed, and also Rakta Prasadana. Virechana does reduces relapse, pacifies pitta, and also does koshta shuddhi. Pralepa does vrana ropana and varna prasadana. Thank you. And these are the references where I collected the information.
Thank you, Kushi. Over to you, judges, for the further questions and queries to Kushi.
Congratulations, Kushi. You did a wonderful job.
Thank you, sir.
Okay. So when we consider the treatment protocol, we have focused on Etiopathogenesis Chikitsa, isn't it?
Yes, sir.
So when we think acne vulgaris, a stress is also considered as an important factor. Agree?
Yes, sir.
So whether only Ipti is sufficient or we have to incorporate Sattva Vajaya, if so, how to?
Satvavajaya can also be included, sir. Also asking the patient to practice few yogas like pranayama, Shitali pranayama especially, which controls the stress level. And also as I used Yukti Vyapashraya, I would like to say this point that Virechana, it also does Koshta Shodhana. So, as I read few articles, is gut brain axis, where when the gut is relieved from all the toxins, mental, like brain also have important role in, like, I would like to say that when gut is cleared and a proper patya is followed, the sattva of the person also increases.
Okay, Kushi, very good attempt. Congratulations.
Thank you, sir.
Thank you, judges, and thank you, Kushi. Heading over to the next presentation, the fifth presentation would be by Maria Jaya Mari from Nanda Ayurveda Medical College and Hospital. And her title of presentation would be A Conceptual Study of the Impact of Heavy Metals in Cosmetics with special reference to Mukhalepa Prayukta Visham and Anjana Prayukta Visham. Over to you, Maria.
Good evening, all present here. I am Maria J. Mary from Nanda Ayurveda Medical College, studying final year BAMS. I'm here to present the topic on cosmetic toxicology and its Ayurvedic management. Introduction. First, nowadays we are using the cosmetic, which was much more loaded with many chemicals, particularly heavy metals such as lead, mercury, etc. And this concept was correlated with the context of Abhyanga Prayukta Visham, Mukalepa Prayukta Visham, and Anjana Prayukta Visham, which was explained by our Acharya Sushruta in Sushruta Samhita, Kalpasthana, first chapter, that is Annapana Raksha Kalpa. And the Abhyanga Prayukta Visham, the Visha, the Dravya, which has Visha in it, when we use these Dravya as Abhyanga means, these Dravya will look like more of Vichilatva and Bahulo, thickness will be more, and it is of various colors, and it will result in the toxicological manifestations such as Poda and Strava and Paga, ulcerations will be there, and there will be sweating, Svedana and Jwara. Dharanam Chabi Mamsanam Abhyange Visha Samyude, which means Mamsa Dharanam will be there, the skin will peel off, and the next 4 lines will be the treatment protocol. The patient should be bathed with the Sheetambu, that is cold water, along with the Lepana of Chandana, Tadara, Kushta, Ushira, Venupatrika, Somavalli, that is Gudichi, Amrita, Shweda, Padma, Kaliyaka, Twak. These formulations can also be used as a pana when mixed along with the juice of kapita and the gomutra. Then Mukalepa Prayukta Visham, it will result in Mukashyava, that is hyperpigmentation, and it also exhibits the features as like that of poisoned Abhyanga, that is Abhyanga Prayukta Visham, and it will be more resembles like that of Padmini Kandaka Prakye, which means thorny eruptions will be there, and the treatment protocol will be drinking honey, gruda, which is of Vishahara nature, and the application of Chandana, Druda, Payasya, Maduka, Fanji, Bandhujiva, Punarnava. And this Mukalepa Prayukta Visham and Abhyanga Prayukta Visham, which was correlated with mercury poisoning. And this mercury was included in some of the skin brightening creams. And these creams were made outside the United States, such as Turkey, Pakistan, and China. And these creams are mainly used to lighten the skin and to get rid of the wrinkles, freckles, acne, and other blemishes. And these strains will not only harm the user but also harm the persons who are surrounding them. Especially the children are morely affected by this, and they were mostly affected in their central nervous system. And the clinical features will be excessive salivation with metallic taste in mouth, insomnia, abnormal sweating. It was already quoted by our Acharya Sushruta, that is Veda, and Ruja also quoted by him. Headache, mercurial lentis, It is a manifestation in the lens of the eye, and Danbury tremor, it is an intentional tremor when it is affected with the CNS. And the case of mercury poisoning was mentioned in the newspaper of Kottakkal, and this was a news title, "A Word of Caution to those using varied creams for beauty enhancement. These mercury-containing fairness cream will cause the kidney disease to the one who is using that creams. Mainly, the disease named membranous nephropathy. It is a rare kidney disease, and it mainly damages the filtering membrane, and the protein was lost through the urine. Then Anjana Prayukta Visham. The manifestation of it was Daha burning sensation will be there, and it also results in the Andhyatvam, that is blindness of the eye. Then the treatment protocol will be Peya, Tarpana using the Magadi, that is Pippali, and the Grida. Anjana, which is made of the juice of Mesha Shringi, Niryasa of Varuna, Mushkaka, Ajakarna, and Fena mixed with Gopitta, Pushpa of Gopitta, Mesha Shringi, Balladaka. These are all the treatment protocol for Anjana Prayukta Visham, and it was directly correlated with the lead poisoning because the kajal which we are using nowadays contains the lead in it, and it will exhibit the following symptoms such as metallic taste in mouth, dry throat, excessive thirst, burning sensation in abdomen, vomiting, headache, insomnia. And the common lead products are lead sulfate in the collyrium, which was widely used by Muslims as surma, and lead tetroxide, which is sindur or vermilion. Thank you.
Thank you, Maria. Now over to you, judges, for the further questions and queries.
I would like to congratulate the presenter.
Thank you, sir.
Can I ask one question?
Yes, sir.
Which cosmetics, among the cosmetics, which is having more mercury? Which cosmetics among the cosmetics?
Fairness cream, sir. Skin brightening creams, which contains mercury and lead in it, and it will contain more than that of preferred dosage, sir. And this case was original case which was reported in Kottakkal for a 14-year-old girl, and along with her family members also suffered with this kidney disease, sir.
With the how it affects the other members?
Sir, actually, that girl, 14-year-old girl, used first, sir. And she had a tremendous effect on it, sir. Like it has a huge role in the hyperpigmentation. So she itself suggested the cream to the other members in her family, sir. So others also used, and within a period of 2 months, they all experienced the same symptoms side by side, sir. So nephrologist, I don't know his name, sir, but he was the one who discovered this case, sir. Like it is due to this fairness cream, they all have this kind of problem.
Okay. The other thing is not only the fairness creams, most of mercury containing lipsticks also have the same
Yes.
effects.
Yes, sir.
Okay, thank you.
Thank you so much.
Thank you, Maria, and thank you, judges. The next presentation would be the sixth one by Sanchana VN from Sharada Ayurveda Medical College and Hospital, Talapadi, Mangaluru. Her title of presentation would be A Bird's Eye View on Hirsutism and Ayurveda. Over to you, Sanchana.
Good evening, everyone. I'm Sanchana, fourth professional BAMS from Sharada Ayurveda Medical College and Hospital, Mangalore. Ma'am, am I audible?
Yes, Sanchana.
Is my
Yes, your screen is also visible. You can start presenting.
Okay, ma'am. Yes, good evening everyone. I'm Sanjana VN, 4th Professional BAMS from Sharda Ayurveda Medical College and Hospital, Mangalore. Today I'll be presenting on the topic A Bird's Eye View on Hirsutism in Ayurveda, guided by my guide Dr. Sahana Ji, Assistant Professor, Department of Prasuti Tantra and Stri Roga from Sharda Ayurveda Medical College. Yes, ma'am.
If possible, put your screen over slideshow mode so that it would be comfortably visible.
Okay, ma'am. Is the screen visible, ma'am?
Yes. Now you can start with.
Okay, ma'am. Getting into the topic, in today's world, beauty is mistook as a tool to gain confidence and respect in working areas, irrespective of imbalanced lifestyle and unhealthy food. Excessive facial hair growth in females is being one of the burning issues, and almost 5 to 10% of the women are suffering from this. Now, let's understand more about hirsutism. Starting with the definition, hirsutism is the excessive growth of the androgen-dependent sexual hair in facial and central part of the body that worries a female. There are other conditions where we can see excessive hair growth. They are hypertrichosis and virilization. Hypertrichosis is excessive growth of non-sexual hair in normal location, whereas in virilization, hirsutism is one of the symptoms and also can be associated with other symptoms like male pattern balding, clitoromegaly, breast atrophy, etc. Today, a lot of females with these conditions are suffering from social distress by avoiding themselves from the crowd or masking up themselves. When it comes to hair removal techniques, there are two methods which assist this. That is depilation and epilation. Depilation is a method where only the part of the hair above the skin is removed, like waxing, threading, etc. In epilation is a method which removes the hair from its root like laser electrolysis, but which has its limitation being expensive, takes more sittings, followed by post-procedure complications like burns, scars, and skin inflammation. So, there is a need of formulations which are safe. In our classics, our acharyas had mentioned references in concern with these issues and have explained various formulations which are cost effective, using easily available drugs with less post-procedure complications. Moving on to aims and objectives, my main aim is to give reference on hirsutism in Ayurveda along with its formulation to make sure it is cost effective and to see that it causes less post-procedure complications. Coming to methodology, a thorough review on the concept and formulations are referred from Charaka Samhita, Sushruta Samhita, Sharangadhara Samhita, Kashyapa Samhita, Kayyadeva Nigantu, and Vaishajya Ratnavali. There is no direct reference of hirsutism in Ayurveda, but there are multiple references regarding the hair and hair growth in our classics. Acharya Charaka in Charaka Samhita Sutrasthana's 21st chapter, Ashtaninditiya Purusha Adhyaya, while explaining the Ashtanindita Purusha, the people who are undesirable for the treatment, have mentioned that one such avastha is Atiloma avastha. Other reference from the same Samhita is from Sutrasthana 27th chapter, Annapana Vidhi Adhyaya. Under Phalavarga, while explaining the properties of Shami, he mentioned Shami has the property of Keshapraksha. And another reference is from Vimanasthana 1st chapter, Rasavimana Adhyaya. While explaining the properties of Kshara, he says that excessive consumption of Kshara is Kesha Upaghatakara. And while explaining the property of Lavana, he says excessive use of Lavana causes khalitya and palitya. Kashyapa in Kashyapa Samhita Uttaratantra 6th chapter, while explaining pushpaghni under Jataharini, mentions the term Stula Lomasha Ganda. Acharya Sushruta in Sushruta Samhita Chikitsa Sthana 1st chapter Dvivraniya Chikitsitam, while explaining the wound healing process, gives 4 formulations for depilation and mentions it has Lomashatanam Uttamam. And another reference from the same Samhita is from Sutrasthana 46th chapter, Annapana Vidhi Adhyaya. While explaining the properties of Shami under Phalavarga, he mentions Shami does Keshanashana. One more is from Sushruta Samhita, Sutrasthana 11th chapter, Ksharapaka Adhyaya. While explaining Kshara properties, he says Chedana, Bhedana, Lekhana, Dharana properties assist in depilation. That is Lomasatana. Vaishajya Ratnavali under Kshudra Rogadikara mentions 10 Lomashatana yogas under the heading Lomashatana Vidhihi. There are lot many yogas in our classes mentioned, but I have presenting only the selected ones, 2 from Sushruta Samhita, 2 from Sharangadhara Samhita, and 6 from Vaishajya Ratnavali. Coming to the discussion, the common ingredients found in almost all of the Lomashatana yogas are Haratala, Shankabhasma, Kadali-kshara, and Shami. Shami Phala has the action of Kesharit, Pittavardhaka, and Ushnavirya. Ballataka is also an Ushnavirya substance having Chedana, Bedana, and Pittala property. Kadali-kshara, Palashakshara, Arkakshara, Shankabhasma, all these are alkali in nature, which are ksharas, and as I mentioned before, it helps in depilation. Coming to the conclusion, though Atiloma was mentioned under Nindita Vyadhi by Acharya Charaka, most of the Brihatrayis, Lagutrayis, as well as other classics have mentioned about Loma Shatana yogas, which gives evidence for the fact that Atiloma avasthas exist and is manageable. As a lot of the modern way of hair removal techniques has got many complications on skin, there is a need to cure them effectively and in safer way. Choosing our classic science would give out best results as per the need. These are the references. Thank you.
Thank you, Sanchana. Judges, over to you for the further questions and queries.
Congratulations, Sanchana. Very good compilation you have made.
Thank you, sir.
When we treat any condition, it has to be treated from the root. Agree?
Yes, sir. Yes, sir.
So, what are the formulation you have suggested? Are they giving just a Lakshanika Chikitsa, or we have to trace the root cause for it?
Yes, sir. Actually, as I mentioned before, we have techniques in modern also, like laser and electrolysis, which remove the hair from its root. But they require more number of sittings, and as we all know, it is not affordable for many of the people. So we are suggesting the formulations in Ayurveda by using the easily available drugs. By application of at least 6 to 7 applications, it is seen that some of the yogas which I have mentioned removes the hair from its roots, sir.
Okay. You have pursued my question in positive way only. But my question is, like for example, Hirsutism is the presentation because of underneath certain diseases or conditions.
Yes, sir.
So, do we have to plan considering the basic samprapti, or just we have to go for Lakshanika Chikitsa?
Sir, it depends on the condition, sir. Like if it is in case of PCOS or in that cases, then we have to consider based on the pathogenesis, samprapti, sir. Or if it is just idiopathic, like which doesn't have any cause, then we can go for these kind of external therapies.
Okay, thank you.
Thank you, sir.
Sinchana,
Yes, sir.
you also have a small question.
Okay, sir.
Have you observed any practical local application for this? Practically using it?
No, sir, I have not.
Actually, you have told that Shankabhashma and Haritala. That is
Yes,
very
sir.
effective. That is very effective with the
Yes.
kadali juice. That is in Sri Lanka we are using that combination, that Haritala 1 part, Shankabhashma 4 parts with kadali juice. That is very effective. After applying that formulation, within 30 minutes we can pluck the hairs
Okay, sir.
very easily. Very easily we can pluck the hairs. Okay, thank you.
Thank you, sir.
Thank you, judges. Thank you, Sanchana. Now the 7th presentation by Akhila KM from Sharada Ayurveda Medical College, Talapadi, Mangaluru. Her title of presentation would be an overview of Keshaprksha in Pushpaghni. Over to you, Akhila.
Ma'am, am I audible?
Yes, Akila, you can start over.
Namaste everyone. Myself Akhila KM, final year BAM student, presenting on the topic an overview of Keshaprksha in pushpaghni, guided by Dr. Archana AV, Department of Prasuti Tandra and Sri Roga, Sharda Ayurveda Medical College and Hospital, Mangalore. We all know that hair has social and psychological significance as it is closely related to self-identity, confidence, body image, and overall look of the person. Hair loss can lead to significant psychological distress like low self-confidence, low self-esteem, even leading to anxieties. And nowadays, young adults often neglect the essential self-care habits like eating healthy, adequate sleep, and exercise, etc. And this fast urban lifestyle can bring about diseases, and PCOD is common among them. According to Acharya Kashyapa in Revadi Kalpa Adhyaya, he mentioned a condition known as pushpaghni jataharani, which is similar to that of PCOS in modern condition. And in PCOS, androgenic alopecia, which is very common in that. And androgenic alopecia is a prevalent form of hair loss, which affect about 22% of the women with PCOS. So, in Pushpaghni Jataharini, Acharya Kashyapa had mentioned due to the intake of Abhishyanda Ahara, there will be Kapha Pitta Vritti, leading to vitiation of rasa as well as rakta and causing Pushpaghni Jatarakni, leading to symptoms like anovulatory menstrual cycle, increased facial and body hair. Coming to PCOS, in modern, etiologies is like environmental toxins, genetic predisposition, gut dysbiosis, and improper diet and lifestyle, which causes hormonal imbalance, hyperandrogenism, and insulin resistance. And the clinical features of PCOS includes hirsutism, acne, oligomenorrhea, anovulation, irregular menstrual cycle, and infertility, which also increases the risk of metabolic disorders. Nidana samrapti of PCOS in Ayurveda may be described as due to apatya ahara vihara, tridosha dushti will be happening, which leads to artava rasovaha srodho dushti, leads to mandagni and ama utpatti, which leads to imbalance in the hypothalamo pituitary ovarian axis, and which leads to artava srodho rodha, and finally lead to multiple immature follicle growth, that is cyst formation, that is PCOS. So basically, we all know that Jatarakni is responsible for the formation of Annarasa, which is considered as a nutrient factor of food, which is absorbed by the Ama Pakwashaya, which represent the basic nutrient required for the nourishment and building up of the Saptadhatu. So basically what I want to convey is, if your Jatarakni is not proper, means Uttara Dhadu Vritti won't be happening properly, which leads to destruction of the Asti Dhatu, that is Asti Dhadu Kshaya as well as Asti Mala Kshaya. And Kesha is an Asti Mala, so it will be ending up in Kesha Shada. So now let's move on to the treatment aspect. So the treatment aspect or the treatment measures which can be performed according to the Nidana and Samprapti. So basically the treatment will be focusing on Avarana as well as Agni Chikitsa. So general Avarana management include Anabhishanti Chikitsa, Shodho Shodhana, Rasayana Chikitsa.
Please make your slide to a slideshow mode.
And if the is it fine, ma'am?
Yes, you can continue.
And if the condition is occurring due to Kapha Vridavada, then managing like Legu Ruksha Ahara, Swedana, Tikshna Basti, Vamana, and Virechana. And if the condition is arising due to Mandagni, Chikitsa are like Deepana, Pachana, Vamana. These are some of the formulation. Now, coming to the case study, a patient aged 23 who is unmarried complains of irregular menstrual cycle, weight gain, blackish discoloration over the neck region, and facial hair growth since 8 months, associated with the severe hair fall since 6 months. On scanning report, diagnosed with the PCOD. So, in this case, which this above mentioned medications like the Chitragadi, Avipathagar, and all of the formulations has been used, and the PCOD condition was managed, and there was a noticeable reduction in the hair loss, which attained gradually. And this is an article which I came across, and in this managing is a bit different. The case is like a female patient aged 28 who who was a known case of PCOS, was complaining of thinning of hair and balding with the increase in irregularity of periods since 3 years. So, their management of the condition is done by modification of diet and lifestyle, including yoga and journaling in the daily routine. The following asanas like Kapalabhati, Pranayama, Sarvangasana, Parvadasana, etc. has been performed, and the visible results were obtained after 1 year. The result were improved focus, stoppage of hair fall, improved attentiveness, improved digestion, improved hair growth, and improved skin glow. So finally, I would like to conclude that for an improved hair growth, instead of focusing or following the commercial ads of the harmful shampoo or cream, instead try to focus on the Jatarakni, that is the gut microbiome, because Jatarakni is responsible for the Uttara Dhatu Poshana. That is, if your Asti Dhatu get Poshana, Asti Dhatu Poshana happen means Asti Mala also will get the Poshana. That is, Asti Mala is the Kesha. So Kesha Shada can be controlled as well as Kesha can be grown properly. And also by opting Vyayama, exercise or yoga, that is Pranayama or Shashangasana or Sarvangasana, etc., which also help for the improved growth of the hair. And also by following a healthy sleep routine, that is Nidana, will also help to stop hair fall.
Akila, your time is over. So thank you. Judges, over to you for the further questions.
Very good presentation, Akila. Akila, am I audible?
Sir, you're audible, sir. Akila, you can unmute yourself.
Okay, she may be hearing. Okay, right. PCOS is a very interesting and very difficult disease to manage in our day-to-day practice. Right, Akila?
Hello, sir. Hello, sir.
Are you listening?
Am I audible?
Yeah, definitely. You are audible.
Okay, sir. Can you please repeat?
Yeah, sure. PCOS is a very challenging disease to manage in our day-to-day practice.
Yes,
We can find a different spectrum in PCOS, isn't it?
Yes, sir. Yes, sir.
One may we find hair loss.
Yes, sir.
And another side we find Hirsutism also.
Yes, sir. Yes, sir.
And your Samprapti, while explaining, you mentioned the Asti Dhatu
Yes,
Mala.
Yes, sir.
Right. Why there is a contrast feature?
Because if Asti Dhatu is properly nourishing, even the Asti factors like Asti Mala also getting nourished. So because that sloga is Asti Vriddhi and Asti Kshaya. If Asti Kshaya is happening, that is Sadanam, then the Kesha Nagadishu. Kesha is also effective. But if Asti is getting Vriddhi or the Uttara Dhatu portion is happening properly, even the Asti also will get the Poshna as well as Asti Mala, that is hair also will get the Poshna. Thereby, by correcting the Agni, by the basic level, we can manage it.
Okay. And while explaining, you have mentioned one term, like when we focus on the Jhataragni, you said you have to focus on gut microbiome.
Yes, sir.
So, are you considering Jhataragni as gut microbiome?
Jatarakni is a whole concept. No, gut microbiome can comes under the Jatarakni because gut microbiome always helps to keep the proper functioning of the gut as well as the proper chemical reactions in the gut.
Gut microbiome are bacteria.
Yes, sir. Bacteria, fungi, virus, anything.
Virome, all those will come.
Yeah.
So, are they of our body?
Excuse me, sir.
Like
Hello?
when you say gut microbiome, are they belong to our own body or they are
No,
microorganisms?
it's there in our own body, our own gut. It is there because even in our gut, hydrochloric acid is there, right? There are so many chemical reactions are happening, right? Enzymes are there, right? And gut microbiome is present inside our gut itself. And the good flora or the natural or the healthy flora of the gut microbiome will always help the digestion, peristalsis, and all the intestinal things to this thing properly.
Okay, there are different views upon that. Okay, if possible, I'll share the article along before you.
Sure, sir.
Okay, to differentiate gut microbiome from Jatragni.
Okay, sir.
Akila,
Yes, sir.
Akila, can you explain according to the Dhatvagni how that Asti Dhatu and Asti Mala concept using the Dhatvagni?
Using the Dhatu Agni. See,
Yeah.
if our Jataragni is considered as the main Agni, no? So if the Jataragni is proper, and if our Agni and Tridosha and the Agnis are proper, Dhatu Agni will also can be proper. And even the once from the Jataragni, if the Uttara Dhatu Poshna is happening properly, means if all the Dhatu is getting the proper nourishment, then Dhatu Agni also will get that nourishment. I mainly focusing on the Jataragni because we
No,
can.
if it's the Dhatvagni excuse, if the Dhatvagni between Asti and Majja Dhatu is affected, what can be happen?
Excuse me, sir?
If in the Uttara Nyaya, no, that Asti Dhatu becomes Majja becomes Shukra, no?
Yes,
If the Dhatvagni between the conversion of Asti Dhatu into the Majja, that if that Dhatvagni is affected, what will happen?
Because, sir, even that in Dhatu Poshna Nyaya, there is actually Kshira Dadi Nyaya, Kedara Kulli Nyaya, and Kale Kapata Nyaya. And Kshira Dadi Nyaya alone cannot explain all this thing. So I would like to focus more on the Kedara Kulli Nyaya as well as Kale Kapata Nyaya. And
according
even
to the Kshira Nyaya, what will happen?
If it is Shira Dadi Nyayam is obvious. If Asti Dhatu is not coming properly, the next Dhadus also won't be coming properly. And Kshira Dadi Nyaya is not actually universalized because of this issue.
From that Nyaya, you can explain the Hirsutism because if that Dhatvagni between the Asti and Majja if affected, then the Asti Mala is increasing. Okay. Asti Mala is increasing, then the Uttara Dhatu is getting depletion. The Majja and Shukra. That Hirsutism in the PCOD can be explained according to that Nyaya. That I want to. Okay, thank you.
Thank you, sir.
Thank you, judges, and thank you, Akhila. Moving on to the eighth presentation. The eighth presentation would be from Harshita Yadav from Sharada Ayurveda Medical College and Hospital, Thalapadi, Mangaluru. And her title of presentation is on the role of Shodhana in hair. So over to you, Harshita. And I request Akhila to stop sharing her screen.
Am I audible, ma'am?
Yes, Harshita.
My slide is visible, ma'am.
Yes. You can start.
Okay. So, very good evening to all present. My name is Harshita from Sharada Ayurveda Medical College and Hospitals. Today's topic of my presentation is the role of Shodhana in hair, which is guided by Dr. Shilpa Suraj ma'am, Professor Department Panchakarma at Sharada Ayurveda Medical College and Hospital. So here is the contents of my slides. Introduction. In Ayurveda, Kesha is mentioned as a Kitta portion of a Asti Dhatu. Sharangadhara have mentioned as a Upadhatu of a Majja Dhatu, and it is a Pittaja Bhava. In modern, Kesha is a keratin-based protein filaments grows from the follicle found in the dermis, which is defining characteristics of a mammal. The hair care is the topic of a prime concern in the present cosmetology. We find the brief reference regarding the hair disorders in Ayurveda, such as khalitya, palitya, and indrarukta. The symptoms are hair fall, premature graying, patchy hair loss, and in modern, it's a premature graying, alopecia. Nidana. Ayurveda has a mention of various aharaja, viharaja, and a manasikati nidana, which contributes aggravating of a pitta and a vata. In contemporary science, the various factors such as unhealthy dietary habits, nutritional deficiency, stress, hormonal imbalance, and environmental conditions leads to the premature graying, hair loss, hair thinning, structural damage, etc. Pathogenesis. So, by above mentioned nidanas, the ama formation takes place, and ama are the prime cause of various disorders. In modern concept of ama can be compared to the unstable reactive free radicals, which are the main cause of numerous diseases and degenerative changes in our body. Free radicals are unstable atoms that have an unpaired electron. They seek to the atom to bound to, leading to the oxidative stress, thus leading aging symptoms range of illness. Then management. Ayurveda have explains both preventive as well as a curative management. Preventive is dinacharya, ritucharya. Curative is nidana parivarjana, shodhana, sthanika chikitsa, in which Mugni Taila is explained, and Rasayana. And in modern various oral and topical application as well as the surgical treatment are explained. So, benefits of Shodhana. Shodhana is a procedure in Ayurveda, such as a Vamana, which mentions such as a Vamana and a Vamana in which Indriya Marga Vishuddhi, Virechada, Shrotu Vishuddhi, while in Nasya and Rakta Mokshana have a specific mentioning of the Kesha Vikaras. Then Sthanika Chikitsa and Rasayana. Sthanika Chikitsa, Mugni Taila is explained, and by using the formulation such as a Bringaraja Taila, Yashtimadhu Taila, Triphaladi Lepa, Amalakyadi Lepa, Kashvarya Taila, etc. And the Rasayana is mentioned after the Shodhana, which works wonder. We have a Kesha Daravya such as the Amalaki, Bringaraja, Neeladi, and the Rasayanas are Amalaki, Narasimha Rasayana, and Chavan Prasha, etc. Then probable mode of action. Vamana and Virechana enhances the antioxidant defense and suppresses the oxidative stress and reduces free radical generation, prevents lipid peroxidation and reduces inflammatory markers. Basti stimulates the enteric nervous system, thus stimulating CNS and altered the gut microbe status affects the brain functioning. Nasya acts through the vascular and lymphatic pathways and stimulate at a neuroendocrinal levels. Saktamokshana improves perifollicular vascularizations and thus strengthens the hair follicles. Discussion. Various etiological factors contribute in the formation of ama, which is a free radicals leading to the various hair disorders. Shodhana therapy does the Shroto Shuddhi and corrects the Agni and expels the ama from the body. As a result, nutrition, metabolism, and elimination of a waste product takes place at a cellular level. Sthanika chikitsa, such as a Mugni Taila and the Lepa, helps in a better absorption of drugs. Administration of a rasayana as a source of antioxidants will help in the growth and the nourishment of a hair. Here's the conclusion of my slides. Various preventive and promotive measures are mentioned in the classic in the form of dinacharya and ritucharya to prevent hair disorders and to obtain healthy and strong hair. Before starting the treatment of hair disorders, physicians should identify the nidanas and nidana parivarjana should adopt it as a first line of a treatment. Shodhana therapies followed by sthanika chikitsa and the rasayana therapies act as an effective combination in the treatment of hair disorders. So invest in your hair. It is the crown. You will never take it off. Thank you.
Thank you, Harshita. Judges, over to you for the further questions.
Very good presentation, Harshita. I have few suggestions. Like when you are presenting, the PPT must contain very minimal words, and we expect you to present it more rather than the reading. Otherwise, it's a very good presentation, very good compilation. And the second point is, which I wanted to ask, when you think about Shodhana and the Rasayana, what is the role of Rasadhatu in hair health?
So we are taking Shodhana after Rasayana. As we know, Shodhana will remove the ama formations and Rasayana will that time more efficiently that time. And Rasayanas are having the, the rasas of... hello. I'm audible, sir?
Yes, you are audible. Please go ahead.
Yes, sir. So Rasayana, in Kesha we have basically mentioning about the Amalaki Rasayanas, Amla Pancharasa which contains and Narasimha Rasayanas it is. So taking Rasayana after Shodhana will affects more as taking before the Shodhana.
Okay, but you have to remember there is a huge role of Rasadhatu, the first dhatu itself on the hair growth. Isn't it? Because
Yes.
Akala Valaya Palitani, when it is mentioned under Rasa Pradoshya Vikara, it is clear cut that Rasadhatu itself is having the role in the nourishment of hair. So that point was a bit missing in your presentation. Otherwise, it's a very good presentation. Congratulations.
Thank you, sir.
Thank you, Aditi. Thank you, judges. The next presentation will be the ninth one by Aditi P. Rao from Sharada Ayurveda Medical College and Hospital. And her title of presentation is about Ayurvedic perspective on hair growth cycle. Over to you, Aditi.
Hello.
Yes, Aditi, you're audible.
Hello. Okay. To all, I'm Aditi P. Rao, final year from Sharada Ayurveda Medical College.
Aditi,
I'm here to present
sorry for interrupting.
on the topic Ayurvedic perspective on hair growth.
Aditi,
Yes, ma'am.
so your voice is breaking, so it would be really good if you can adjust your networks.
Yes. Ma'am. Yes, ma'am.
Yes, you're audible.
Am I audible? Ma'am, is it
Yes,
okay?
yes.
Is it in delay, ma'am?
Now it is audible, but we request you to make your screen to slideshow mode.
Okay, sure.
Yeah.
Okay. So to begin with, I would like to define the term Kesha, Ke Mastake Shete, meaning that which lies over the scalp. And in Ayurveda, Kesha is exclusively for the hair that grows on the scalp. Hair is a crown that one never takes off, like the previous presenter told. Hair is an important aspect in one's life. According to Acharya Sushrita, it is easy as he says that the body structures require constant overall nourishment in order to grow. But hair and nail defy this rule and continue to grow even when the body undergoes deterioration. But in the present era, it has become complicated even after giving much importance to overall nourishment, and hence you can see a rise in hair problems, and the statistics stays the same. Moving on to the review of literature, I would like to begin with Kesha and Garbha Vyakarna mentioned in the Sharirasthana. That is, Kesha is formed in the 6th month of the Garbha, and Pitraja Bhava is the main contributing factor in Roma Kupa formation. And also, an interesting factor is that Roma Kupa formed in the Garbha, the number of Roma Kupas does not increase after the birth. Next, Kesha in discussion of Deha, that is the fully fledged person. In that person, the main component of hair is the mala of Asthi, and hence when there is Kshaya of Asthi, there is Prapatana of Kesha. The second is the Deha Poshana, which is explained in the Sutra Sthana of Annapana Chatushka, where we can see the Ahara Rasa, which nourishes the Prasada Bhaga, nourishing the Dhatus, and the Kitta Bhaga, nourishing the Malas of the Dhatus. Hence, nourishment of Kesha is done by the Ahara Rasa. And to justify this, we can say Rasa Dhatu Dushti leads to Palitani. Next is the maintenance of the well-formed hair, which is done in Medasara Purusha. We can see dense, lustrous hair, that is Visheshataha Kesha, due to the Sneha Guna of the Medo Dhatu. Contrary to this is the Kshara, which has Ushna Tikshna Guna and leads to Kesha Upaghata. And also the Teja and Anila plays an important role, and hence if it is not in balance, it can cause khalitya and Kinchit Palitani. In a Medasara Purusha, because of Swabhava Uparama, there can be hair fall. Moving on to the discussion, I have applied Adhikarana Tantra Yukti in order to understand the hair growth cycle. That is the first stage being the formation of Romakupa, second stage being the eruption or the formation of the hair, third stage being the nourishment or the portion of the hair, and finally the maintenance of the well-formed hair. So to begin with, first stage of hair growth, which is the formation of hair follicle, mainly the genetic factors come into picture, which is the Pitraja Bhava, where they've already mentioned that Roma Kupa na varthate. It does not increase in number after birth. So the role of Vaidya comes into picture, where Garbha Samskara can be adopted. And also the mother's Vayu, Agni and Vayu, and the Ahara Rasa that she consumes also has an effect on the Roma Kupa. Second stage is the eruption of hair. So the raw material required for the hair formation is the Asthi, which undergoes Kharapaka to get the structure of Kesha, along with obviously the Agni and Maruta, which helps in the action of eruption of the hair. So the concerned scene would be thinning of hair and hair fall, where we can concentrate on the Asti Dhatu, correcting the Agni in the person. Third stage would be the nourishment of the hair, which is done, the Poshana, which is done by the Ahara Rasa. To justify this, in a Twaksara Purusha as well, due to the Shleshmata, there is Mrudus Lakshana and well-formed hair. Hence, Rasa Poshana becomes important. If the Dhatu Dushti is seen, there can be Palita, that is premature graying. Fourth stage and the final stage of hair growth would be, again, like I mentioned, Medasara Purusha, due to the Shleshmata of the Medo Dhatu, right? So Shleshmata is Shleshma Alingana, that is to hold. So to hold the Kesha in the Roma Kupa for the Swabhava, like Swabhava, for the normal amount of time. This is seen due to Dhatu Sneha Parampara between what Meda, Asti and Rasa. If this is proper, you can see a healthy hair growth cycle. If not, there can be hair fall. So I would like to conclude by saying that hair growth cycle can be understood by applying Adhikarana Tantra Yukti. First stage of growth cycle begins in the Garbha Vyakarana stage. Number of Roma Kupas found in the newborn cannot be altered post-birth. Genetic factors, that is Pitraja Bhava, play in deciding the Roma Kupa. Second stage is eruption of hair, which is taken care by Agni and Vayu. Hence, Jatara Agni and Vata needs to be taken care. Structure and form is given by the Asti Dhatu. Third stage is nourishment to the erupted hair, which is given by the Ahara Rasa. If the nourishment is not met, then premature graying is seen. Fourth stage is maintenance of hair by the Dhatu Sneha Parampara between Meda, Asti and Rasa Dhatu. If Deha Ushmata is interrupting this Dhatu Sneha Parampara, diseases like Indralupta, khalitya are observed. Thank you. I would like to thank the organizers and also my guide. Thank you.
Thank you, Aditi. Judges, over to you for the further questions.
Very good presentation, Aditi.
Thank
Congratulations for your efforts. With Adhikarana Tantra, you have explained very beautifully. When it comes to the Genetics. Okay. What is the role of Prakriti in the hair growth cycle?
When we can understand Prakriti, sir, formation of Prakriti depends on the Bija Shonita and the time of birth, place of birth. So all these factors can be included.
So we have to consider Prakriti. Agree, right?
Yes, sir.
Okay.
And hence we can even also consider the Sara also will have an effect.
And do we have to consider a disease called aging?
Sorry?
Because aging is a natural disease, isn't it?
Yes, yes, sir. That with aging you can see continuation of hair growth, but you won't see new hair growth from the because the absorption in them would have been reduced comparatively to the young adults, or I think that would make sense.
Okay, good. If these 2 points were again highlighted in the presentation, it would be much better. I agree. Thank you.
Okay, sure, sir. Thank you, sir. Thank you so much.
Thank you, Aditi. Thank you, judges. Next would be the 10th presentation by Kallesh HG from Sushruta Institute of Ayurveda Medical College and Research Center, Davangere. And his title of presentation is Nidana Parivarjana, the primary approach in the treatment of kushta. Over to you, Kallesh.
Is it audible now?
Yes, Kallesh. You can start your presentation.
Good evening, everyone. Kallesh HG, second year UG scholar, Sushruta Institute of Ayurveda Medical Science and Research Center, Davangere. Nidana Parivarjana is a primary approach in the treatment of kushta, guided by Dr. Chinmay L. Chigateri, Assistant Professor, Department of Samhita Siddhanta. Introduction. Ayurveda is a science of life, has mainly basic components like doshas, dhatus, mala, agni. These should be in Prakritavastha. Vikritavastha leads to the Vyadhi. The factors like ahara, vihara, karma, these are mainly responsible for occurrence and absence of the disease. Nidana is used in two different contexts. They are Vyadhijanaka Hetu, Vyadhibodhaka Hetu. In Vyadhibodhaka Hetu, there are mainly five tools. They are Nidana, Purvarupa, Rupa, Upashaya, and Samprapti. Nidana means causative factor. Mrutbhakshana is a Nidana for the Mrutbhakshana Janakandi. Objectives. Prevention is better than cure. Nidana Parivarjana is the first line of treatment. Methodology. Nidana means causative factor or a cause. Parivarjana means avoid that cause. According to Charaka Samhita, Vimanasthana 7 chapter 15 shloka, they explain about Nidana Parivarjana is a prevention and cure of the diseases by avoiding the causative factor in a form of ahara and vihara. Nidana Parivarjana refers to elimination of causative factors which are responsible for development of the disease. Nidana Parivarjana is the first and foremost principle that helps to cure the diseases. Kushta. Kushta is a pathological condition of the skin. They occur due to derangement of the three doshas and dhatus, namely Shonita, Mamsa, Lasika. These will cause the Kushta. Based on predominance of the doshas or dhatus, there are different types of kushta. There are Kapala, Mandala, Udumbara, Kanaka, Rishya Jiva, Pundarika, Sidma. There are different types of Nidanas. There are Aharaja, Viharaja, and Manasika. Aharaja Nidanas are Madhu Matsya, Lakucha, Chilichima with Dipaya, Yavaka Koradosha with Kshira, Dadi and Kola, Kulata and Masha. Viharaja Nidanas like Vyayama, Vyavaya Disivana, Santarpana, Apatarpana, Vetyasa, Shita, Ushna, Vetyasa. Manasika Nidanas like Bhaya, Krodha, Shoka. Masha, Kulata, Ati Vyayama, Chilichima with Dadi. These are the pictures. Samprapti. Nidana Sevana leads to the Prakopa of the Vatadi doshas. This will lead to Tiryagamana of the doshas. There will be derangement in the function of the Tvacha, Rakta and Mamsa Lasika leads to Kushta. This is Samprapti. Observation and discussion. Consumption of the Madhu, Masha, Kulatta, Chilishima leads to vitiation of three doshas, cause the derangement of Rakta Mamsa Lasika, cause the Kushta. Consumption of Atilavana, Ati Amla cause the Kledatva in the body. It will lead to Dushan of the doshas and cause the Kushta. Divasapna causes the Tridosha Dushti, cause the Kapha Prakopa, and also it is a Kledakara, leads to the Dushan of the Dhatus and leads to Kushta. Nidanas, Manasika Nidanas like Krodha, Shoka, Bhaya, these will lead to Prakopa of the Pitta and cause directly the vitiation of the Rakta, cause the Kushta. So prevention the Ahara Vihara Karma which cause the disease of the conclusion. In present era, unhealthy diet, improper lifestyles are main factors for onset, progress, and reoccurrence of the diseases. It is very important to know the cause of the disease because when cause of the disease is known, prevention and management of the disease become very easy. To prevent the disease and manage the disease, Nidana Parivartana is important. To maintain the health in the health individual and to cure the disease in the diseased person, Nidana Parivartana is important. Thank you.
Thank you, Kadesh. Judges, over to you for further questions and queries.
Hello. Am I audible?
Sir.
Hello.
Sir, you are audible.
Yes, sir.
Okay. I want to ask a question. You are talking about the cosmetology, no? Your presentation is related to the cosmetology. Is it?
Sir.
Then which cosmetic diseases related to cosmetology, which diseases you have taken?
Sir.
About the Nidana Parivartana? You have taken the Kushta.
Kushta, sir.
Among the Kushta rogas, which diseases you have taken?
Sir, general.
Because you have to.
Nidana and Nidana.
Which one?
General Kushta, sir. Nidana Parivartana.
Yes, there are 7 Kushtas are there, no? The Chudra Kushta and Mahakushta. Among those, which diseases you have taken as a cosmetic problems? Because most of the cosmetic issues we have described under the Shudra Rogas, like mukhadushika, vyanga, all those are under the Shudra Rogas. Which disease cosmetic problems you have taken? Because you have taken the Kushta Nidana and Nidana Parivartana, all these from Kushta. Am I right?
Sir, I have taken.
You have focused on which diseases? The alopecia, all are.
Individual I have taken, sir.
I can't hear you.
Sir?
No, I want to clarify why you have taken the Kushta Nidana in this presentation.
Sir,
Hello.
Kalesh, I agree. Like all the kushta is disfiguring the appearance of an individual. But in your presentation, there are few spelling mistakes. Probably you need to give attention for that. And while explaining, you have mispronounced few things like Kakana Kushta, you said Kanaka. Okay, maybe because of anxiety. And Chilichima with the Dhadi or Chilichima with the Pious. So few things you have to note down.
yes, sir.
Okay, and you have done a very good job, and I appreciate that. Keep it up.
Yes, sir.
Thank you, Kalesh, and thank you, judges. Let's move on to the next presentation. This would be the 11th presentation by Devi Nandana RK from Sharada Ayurveda Medical College. And her title of presentation would be An Ayurvedic Approach to Palithya with Rasayana Chikitsa. Over to you, Devi Nandana.
Am I audible?
Yes, you're audible.
Namaste all. Myself Devinandana RK from 4th Professional BAMS of Sharada Ayurveda Medical College and Hospital, Mangalore. I would like to present on the topic an Ayurvedic approach to Palithya with Rasayana Chikitsa. Coming to the introduction, as we all know, Palithya or the premature graying of hair has become a very common concern in the present era. Even at very young age, like in the 20s or in the 30s, people are suffering from Palithya. It can also affect the self-esteem of that individual. Like an overall increase in the number could be due to the increased urbanization, like lifestyle changes or excessive pollution, etc. In Ayurveda, the Palitya has got many scattered references. In Acharya Sharangdara has classified the Palitya into Kala Janita and Akala Janita Palitya. So the main objective is to evaluate the efficacy of Rasayana Chikitsa in Palitya. So a brief description about Palitya. So it has got its references in the Samhitas under Shiro Kapalagata Roga and Kshudra Roga. So as we all know that Palitya can be directly correlated to premature canitis, which occurs at the age of 30 due to the degeneration of the uh, melanocyte cells, which are responsible for the production of pigments in the hairs. So, in Ayurveda, according to Sushruta Samhita in the Nidana Sthana 13th chapter, there is a Samprapti mention, uh, which goes like due to the Nidana Sevana, like the Krodha, Shoka, and Shrama, there will be Prokopa of the Vata and the Pitta, which leads to the sthana samshri of the Sharira Ushma and the Prakupita Pitta by the Vata in the Shirogata or the Kapala region, which further leads to the Paka of the Kesha, leading to Akala Janita Palitya. Coming to the benefits of Rasayana, we all know that Rasayana therapy is one among the very best and the most important preventive treatment in Ayurveda. As referenced by Charaka Samhita in the Chikitsa Sthana first chapter,
The benefits of Rasayana will be increased lifespan, Dirghamayu, enhancement of Smriti, Medha, Arogya, Tarunam Vayaha, which means the arrest of the early signs of aging. So, in addition, Rasayana therapy in general provide a holistic rejuvenation approach to any kind of conditions. Uh, Beyond treating specific conditions like premature graying of hair, it has got lot many more benefits like the enhancement of cognitive functions, promotes hormonal balance, improves digestion, detoxify the body, and leading to better overall health. So, role of Rasayana in palita. In the contemporary medical science, treatment of premature canitis are nutritional supplements, artificial dyeing of hair, keratin therapy, etc. So instead of providing a cosmetic corrections, Rasayana therapy can be used in various forms like Nasya Yoga, Abhyanga Taila to arrest the aging process by improving the overall health. So these are the references of Rasayana Chikitsa and Khalitya. I have mentioned about Abhyanga Taila, Rasayana which can be used internally, and also Rasayana and also Lepas which can be applied externally. So the Rasayana formulations which are mentioned here are taken from Sushruta, Charaka, Ashtanga Hritaya, as well as Chakradatta, which mainly has Palita as Falashruti in the shloka. So, benefits of Rasayana over other contemporary management. So, instead of using other therapies like the artificial hair coloring, keratin therapy, UV light therapy, use of Rasayana has got its effect as it is cost effective, sustainable, and has minimal side effects. And above all, it addressed to improve the overall health and vitality of an individual. So, in the present era, since palita is a very common and challenging disease, uh, the management of first line management can be Nidana Parivarjana, Shodhana, Nasya, Abhyanga, Pralepa, and Rasayana Prayogas. So, since Rasayana therapy is very much cost effective and are comprised of the simple herbal formulations which are very much available, it dominates other alternative therapies. Hereby, I conclude the presentation. Thank you.
Thank you, Devinandana. Judges, over to you for the further questions.
Devinandana?
Yes, sir.
Okay. Very good presentation.
Thank you, sir.
Right. When it comes to the Palitya, the Rasayana is very important. You agree? Isn't it? So
Yes, sir.
So when it comes to Rasayana, what are the different ahara yogas that need to be incorporated? Because we say food is the best medicine. So can we incorporate any specific food as a treatment of Palitya?
So there are various nutritional supplements which are given, like food which are rich in iron, vitamin B12. These can be given, sir.
In terms of Ayurveda?
Amalaki, haritaki, which has rasayana properties, as I mentioned, can be given, sir.
Okay, good. And for all the presenters, this is my sincere suggestion. When you are presenting, don't put all the content in a PPT. It should be very minimum, otherwise it will turn to be inverted funnel. And for your suggestion, you can watch the TED talk, that is how to avoid death by PowerPoint by David Philippi. So you have to place very minimum content, and through that content you have to deliver the presentation. There is no need that every content of your presentation must be there in this slide. Okay, thank you.
Thank you, judges. And thank you, Devinandana. Let's move on to the 12th presentation, and that would be by Dhanalakshmi K from Sushruta Institute of Ayurveda Medical College and Research Center. And the title of presentation would be Action of Kushtagna Mahakashaya in Dermatological Conditions. So over to you, Dhanalakshmi.
Om Shri Guru Bhyo Namaha. Good evening, everyone. Myself, Dhanalakshmi K, second year BMS, Sushruta Institute of Ayurveda Medical College, under the guidance of Dr. Sahana T, Assistant Professor of Department Dravyaguna, I have presented the action of Kushtagna Mahakashaya in dermatological conditions. As we know that the skin is the largest organ in our body, the skin which reflects our internal and the external pathology also. Where kushta is the skin in Ayurveda, we can consider this skin diseases are a broad heading under the kushta, and it is further classified into mahakushta and shudra kushta, where mahakushta has 7 types and shudra kushta has 11 types. Where kushta means kush nishkarshe, which means tear or to expel. My aims and objectives are to analyze the efficacy and Kushtagna Mahakashaya, where Kushtag in dermatological condition. Kushtagna, where Kushta plus Gna. That Kushtagna Mahakashaya, it is mentioned, Acharya Charaka mentioned it under the third group of Kashaya Varga, comprises of 6 Mahakashaya. It may be appears that the classification is based on the Trivita Roga Marga, where Kushtagna comes under the Bhaya Roga Marga. Where main Nidana, that one which causes the discoloration of the skin, Nidanas are Aharaja, Viharaja, and Manasika Nidanas. The mainly that which the rasa sevana that which we intake our ahara, that which is predominant of amla madura katu and shara rasa and guna guru snigdha ahara and dhadi takra sevana navina dhanya and kulata matsya with paya madhu guda sashapataila. These are the aharaja nidana which causes this mainly skin diseases, and suppression of vegadharana and intake of antiemetic drugs and manasika nidanas like bhaya, shoka, and chinta. So Acharya Charaka mentions 10 drugs under the Kushtagna Mahakashaya, that is Kadira, Abhaya, Amalaka, Haridra, Arushkara, Saptaparana, Aragbada, Karavira, Vidanga, and Kajati Pravala, where I mentioned previously that the Nidana in Aharaja Nidana, mainly the Katu Ahara, Madhura, and Kshara, these are the Ahara which affects the skin. But in these 10 group of Kashayas, the drugs are mainly predominant of Tikta and Kashaya Guna, and the Guna Laghu Ruksha, and the Virya is Shita Virya, and the Madhura and Katu Vipaka, and Dosha Karmas are Kapha and Pitta Shamaka. These, depending on these drugs, have the most predominantly Tikta and Kashaya Guna, Kashaya Rasa, that which acts on the skin. And each and every drugs in the Kashaya Varga have their specific target karma. For example, Kadira. Kadira has the Kleda Prasadana and Anulomana, and Amalaka has Rasayana, Rasarakta Prasadana, Agni, and Pachana, Tvak Prasadana, Kafavata Shamana, Krimigna, and Saumanas. These are the these are the drugs having the specific target on karma on the skin, where the phytoconstituents like catechin, chebulic acid, vitamin C, curcumin, and bilvanol, and benzyl acetyl diatomine, anthraquinone, embelline, these are the phytochemical constituents which have the antimicrobial, antifungal, antioxidant, and anti anti-elementic properties are anti-elementic pharmacological actions on the skin. So observations, the majority of the drugs Kushtagna Mahakashaya have Rasayana qualities also. So immunomodulator, antioxidant, and adaptogenic and anti-stress. Rasayana medications is also supports the both involvement of general and health and the treatment of chronic skin conditions. Based on the examinations, I have mentioned that the group of 10 drugs that which contains intensely, highly the tikta and kashaya rasa have a bitter taste, and it is pretty obvious that since bitter medications are excellent blood purifier, they are the beneficial in treating the skin conditions. Conclusion. In Ayurvedic literature, it is referred that most persistent illness, Tridosha, is the root of for the forms of the Kushta. Hence, the therapy is determined by which dosha predominates. Tridosha Shamaka makes up the majority of medications in Kushtagna Kashaya. The medication is used to treat a variety of conditions, particularly skin disease. Thank you.
Thank you, Dhanlakshmi. Judges, over to you for the further questions and queries.
Dhanalakshmi.
Yes, sir.
So kushta is Tridhosha Pradhana Vyadi, isn't it?
Yes, sir. Yes, sir.
And Kadira said is in Agria it is Kushtagna. In
Yes,
Kushtagna,
sir.
Kadira is Pradhana. Can
Yes,
you
sir.
justify this statement?
Sir, 1 second, sir.
Justify the Agria statement that Kadira is best among the Kushtagnas.
Yes, sir. Sir, in Antar Parimarjana Chikitsa, Kadira is taken as the best drug for the Kushtagna because of it is having the Tikta Kashaya Rasa and Kapha Pitta Shamaka. In Nidana, as I said that the Ahara the Rasa Sevana with predominant Katuk Shara, this will increase the Pitta, sir, though that will further cause the skin disorders. So Kadira is taken depending on this Rasa Panchaka, and it has the chemical constituent catechin in that, sir, which have antimicrobial and antifungal pharmacological actions, sir. So that's why the Kadira is considered as the best for Kushtagna, sir.
Very good. Okay. And in among your slides, you have mentioned the etiologies like
Yes,
Guru
sir.
and Snigdha, right?
Yes.
Snigdha
Yes,
is
sir.
every day need to be consumed. Snigdham
Yes.
Ashniyan. So when you mention it as a etiology, it must be Ati Guru, Ati Shita, or it must be the Satatya Seva. Okay, regular intake in an excessive quantity. So that
Yes, sir.
need to be specified. If you simply say Guru or Snigdha, it not may have a significance. Okay.
Okay, sir.
Otherwise, it's a wonderful presentation. Congratulations.
Thank you, sir.
Thank you, Dhanlakshmi. Moving on to the next presentation. The 13th one will be by Vaishnavi AM from Sushruta Institute of Ayurveda Medical Science and Research Center, Davangere. The title of the presentation is A Review and Critical Analysis of Kushtagna Mahakashaya. Over to you, Vaishnavi.
Good evening, ma'am. Am I audible?
Yes, you're audible.
Ma'am, where is my slides are showing, ma'am?
It's about to come. Yes, Vaishnavi. You can start
Good
the
evening.
presentation.
Okay. Thank you, ma'am. Good evening, everyone. Myself, Vaishnavi, a second-year undergraduate student from Sushruta Institute of Ayurveda Medical Science Research Center, Davangere, and my topic is a review and critical analysis on Kushtagna Mahakashaya. It was guided by Dr. Sahanati, Assistant Professor, Department of Dravya Guna Vijnana. These are the contents that I will be dealing in the upcoming slides. Moving on further, introduction. Skin is the largest organ. It affects the mental and physical state of human being. Skin diseases are caused due to the altered lifestyle. According to Ayurveda, skin disorder can be considered as Kushta. Kushta is again classified into Mahakushta and Shudra Kushta. Kushta arises due to the vitiations of the Saptadoshas, that is three doshas, and the four doshas, Tvak, Rasa, Mamsa, and Lasika. The drugs mentioned in Kushtagna Mahakashaya has Krimigna and Kushtagna Karma. The drugs which are mentioned under the Kushtagna Mahakashaya by Acharya Charaka are Kadira, Abhaya, Amalaki, Haridra, Arushkara, Saptaparna, Aragvada, Karavira, Vidanga, and Jati Pravala. Moving further, Kushta Samprapti, that is Pathology of the Kushta. Kushta is caused by the Nidana Sevana, leading to the vitiation of three doshas, leading to the impairment in Tvak, Rasa, Rakta, and Mamsa, leading to Sapta Mahakushta and Ekadasha Kshudra Kushta, that leads to overall Kushta. Objectives and critical analysis on Kushtagna mahakashaya. Most of the Kushtagna mahakashaya dravya contains Katutikta kashaya and Ushnavirya and Katurasa. Moving on, pharmacological activities of the Kushtagna mahakashaya. Kushtagna mahakashaya dravyas, the main pharmacological activities of the Kushtagna mahakashaya dravyas are antioxidant, antimicrobial, antibacterial, antifungal. Moving on further, Ekamulika Prayoga of Kushtagna mahakashaya dravyas. Acharya Sushruta mentions, as per Acharya Sushruta, in Chikitsa 9th chapter, Kadira is best in Kushta. Kadira Jala is advised in Ahara, Annapana, and Snana in Kushta. Ballataka Taila is advised in Sarva Kushta. Ballataka, Vidanga, and Abhaya Kwata is advised in Kushta patients. Aragvada Patra is advised in Varna Prakshalana. Amalaki Churna Siddha Kwata is advised in Mukha Prakshalana after Dantadhavana, and same Shita Kwata should be put on face. 1 pala of haridra churna with gomutra is advised in Kushta. Moving on to the discussion, Kushta is caused due to the vitiation of the Sapta doshas such as Tridoshas and Rasarakta, Lasika, and Mamsa. The Kushtagna Mahakashaya Dravyas has Katutikta and Kashaya Rasa, which mainly pacify the doshas causing the Kushta. Kushtagna Mahakashaya Vargas Dravyas also possess antibacterial, antifungal, antimicrobial, and antioxidant activities. Conclusion: skill elements affect all the ages of the neonates to the elderly and cause harm in a number of ways, such as discomfort, disfigurement, disability, etc. The knowledge about the importance of herbs in Kushtagna Mahakashaya helps to get rid of skin diseases of mankind in the form of a single drug or along with the ingredients as formulations. Thank you.
Thank you, Vaishnavi. Justice, over to you for the further questions.
Hello, Vaishnavi.
Good evening, sir.
Can you display the Ekamulika Prayoga PPT?
Sure, sir.
Okay, thank you. So, Kadira is advised as Ahara, no?
Yes, sir.
How to administer Kadira as Ahara?
Sir, Kadira bark as churna we can advise, sir.
Churna Matra is very minimal, no?
Sorry, sir?
Churna, when you say Churna, it is the Aushadha Kalpana, no? How to administer it as a Ahara?
Sir, I'll refer it, sir.
Okay, good. Okay, so when we think any any form of medicine, we should know practically how to utilize it. Otherwise, you have compiled in an excellent manner. At the same time, we should know the in a real life practicability of it. Okay.
I think in the slide it is there. Kadira Jala is advised in Aharas. This Kadira Jala, no?
Yes, that's the intention. Okay, no problem. They are just UG students. They will definitely grow up and they'll nurture the science. Yes. Thank you, Vaishnavi.
Thank you, sir.
Thank you, judges. Thank you, Vaishnavi. Moving on to the next presentation, the 14th presentation by Syed Samir from Sushruta Institute of Ayurveda Medical Sciences and Research Center. The title of the presentation would be Ekakala Dravya Prayoga in Kitiba Kushta and Eka Kushta. Over to you, Syed.
Hello, ma'am. Am I audible, ma'am?
Yes, Syed, audible. You can start your presentation.
Good evening, everyone. Myself, Syed Samir, second year UG scholar from Sushruta Institute of Ayurveda Medical Sciences and Research Center, presenting on the topic Ekala Dravya Prayoga in Kitiba and Eka Kushta under the guidance of Dr. Sahanati. These are the contents of the presentation. Introduction. Skin is one among the sense organs which protects us from various external invasions. Due to altered lifestyle, lack of physical exercise, poor hygiene, mental stress, and improper food habits, skin diseases are seen. Kushta is divided into Mahakushta and Shudra Kushta. Kitiba Kushta and is included in Shudra Kushta, commonly found today, having signs and symptoms similar to plague psoriasis. Coming to Nidana and Samprapti, Viruddhahara, Divasopna, Adhyashana, Ativayama, Vegadharana. These are few of the Nidanas of Kushta. And coming to Samprapti, due to Nidana Sevana, Vatadi Doshas Prakopa takes place. It aggravates due to this Tireggamana of Vata takes place, and Tvacha Rakta Mamsa Lasika Visheshan takes place. It causes Vaivarna of Tvacha. Coming to types of Kushta. Types of Kushta are Mahakushta and Shudra Kushta. Mahakushta are 7 types, and Katiba and Eka Kushta come under Shudra Kushta. Purva Rupa. Asvedana, Vaivarna, Kandu, Sputana, Twakshosha. These are some of the few of the Purva Rupas. And coming to Chikitsa Sutra, Nidana Parivarjana is the first line of treatment. According to all Acharyas, Shodhana has been indicated, and Acharya Sushruta has indicated Punar Shodhana in case of Kushta. These are few drugs which are indicated in Kushta. This is Kadira in Agre Prakarana, used as Agre Dravya in Kushta. Used as anti-inflammatory drug, increases Sveda and reduces Kandu. This is Manjishta, Kasamarda, Arjuna, Karanja, Amalaki, Nimba. All these have antibacterial, antimicrobial and anti-inflammatory activity. Ekala Dravya Prayoga. Pulp of amra mixed with Saindava Lavana, rubbed with water in a copper vessel. Amra is rich in vitamins and acts as antioxidant, produces collagen protein in skin and helps to remove dull and dry skin cells. Saindava has antimicrobial and anti-inflammatory activity, does hydration, helps in maintenance of pH balance of the skin. And Tamra helps in exfoliation, helps in hydration. Karavira Mula, cooked with Tilatela along with Gomutra. Karavira helps in reducing inflammation and prevents scaling and increases the sweat outcome. This is Vacha and Kutaja. Vacha with Indrayava pounded along with Gomutra. Vacha has anti-inflammatory activity and has a wound healing property. Kutaja has Tikta Rasa used internally and externally acts in preventing the dryness of skin and does Rasa and Rakta Prasadana. Amalaki and Guda. Amalaki more effective on Kapha dosha. There is involvement of Rasa Rakta Dhatu. Amalaki does Rakta Shodhana and Prasadana. It also does anti-inflammatory activity. Discussion. Coming to discussion, both Eka Kushta and Kitiba Kushta are Vata Pradhana Kapha Pittaja Vyadhi.
In contemporary medicine, they could be correlated to psoriasis. Both Eka Kushta and Pitiva Kushta, Vata Kapha predominant or Vata Kapha predominant. Psoriasis is a chronic anti-inflammatory disease which involves the hyperproliferation in epidermis. Eka Kushta and Pitiva Kushta cardinal symptom is asvedanam due to obstruction of Svedavaha srotas. Hence, the drugs which are used like Amalaki, Karavira, Vacha, Khadira removes the obstruction and increases the Sveda in affected such skin areas. These drugs also has Ushna Vidya, Lagu Ruksha Guna and Kafahara properties. Hence, it clarifies Kafa and does prasadana of Mams and Rakta Dhatu. Relieves the dosha Dushya Samuchana. Other symptoms like itching, scaling, etc. Matsya Shakalopama will be relieved by these herbal drugs. According to modern pharmacology, these drugs also has anti-inflammatory and antimicrobial properties. Coming to the conclusion, psoriasis has no cure. Treatment aimed to reduce inflammation and scales, slow the growth of skin cells, and remove plaques. In today's world of ever-changing diet and work patterns, lifestyle diseases are on a sharp rising pattern. Hence, it is the need of time to find out safe and effective treatment of psoriasis. These herbal drugs are safer and possess Kushtagna, Kandugna, and also antibacterial property, which are potent and safe medicine. Thank you.
Thank you, Sayed. Judges, over to you for further questions.
Side. Hello.
Yes, sir.
Congratulations for your presentation. Side, you have mentioned several times the antibacterial action or antimicrobial action. What is the use of antimicrobial action in the management of Kitima Kushta?
Sir, it will help to reduce the growth of bacteria.
In your presentation, you have told the etiology correctly, how Kitima Kushta is occurring. Are there any any bacterial or any microbial thing in the etiology?
Sir, itching and scalings, which causes
from which dosha itching is occurring?
Kapha dosha.
Not from the microbes, no. It's
Yes,
due to the lakshanas of doshas, no.
Yes, sir. Yes, sir.
There is no need of antimicrobial action and others. It's okay. I want to clarify that.
Yes.
Sayed?
Sir.
Okay. You have used varieties of pictures in your presentation. I
Yes,
appreciate that. But thing is that it was overlapping in your presentation. So
Yes.
most of the things are like jumbled. It is like piled one upon the other. Rather than getting a clarity, it was okay. With the animation, you can work out, I guess.
Yes, sir.
Right?
Yes, sir.
And regarding the presentation, right?
Yes,
I believe antibacterial in case of psoriasis is beneficial in especially gutted psoriasis because post streptococcal infection it tend to develop, so there it may be beneficial. And because my PhD work is on psoriasis, so I'm giving bit of input for you.
Yes.
And infection is said to be the triggering factor. It can flare up the psoriatic condition. So in some cases, whenever we feel that there is an infection and it has triggered the psoriasis, in those cases, probably we need to incorporate the antibacterial properties having drugs. Okay.
Yes, sir.
So when you read, as sir has rightly pointed out, we
Yes,
should
sir.
know from the basics, like why, when it is required. Okay.
Yes, sir.
And Next time when you present, just work out on your PPTs so that it should not overlap like all the animations. Otherwise, it was
Yes, sir.
compiled
Sure, sir.
beautifully. Okay,
Yes,
congratulations.
yes. Thank you, sir.
Thank you, Sayed. Thank you, judges. Moving on to the next presentation, the 15th presentation would be by Rohini Bharat from Dhanvantari Ayurveda College, Hospital and Research Center, Siddhapur, UK. And the title of presentation is Etiopathogenesis of Palithya by the use of Ati Lavana Yukta Ahara. Over to you, Rohini.
Hello.
You are audible, Rohini.
Screen visible?
Yes, Rohini. Yeah, you can start your presentation.
Namaste, respected dignitaries and chairperson. Myself, Rohini Bharat Vagmore, first year BMS from Dhanvantari Ayurvedic Medical College, Siddhapur, under the guidance of Dr. Vishnu Priya, Associate Professor, Department of Chikitsa. So, the today's topic of my paper and presentation is Etiopathogenesis of Khalitya as per Ayurveda Samhita. So, let us move on objectives of this paper. Literature review and the critical analysis of Palithya and to elevate the etiologies of Palithya and also the elevate the pathogenesis of Palithya. So introduction. We already know about Palithya as one of the health condition affecting the kesha, which is the mala of the asti dhatu and causes early graying. There are two varieties of Palithya, one Prakrutik and second is Vaikrutik. As the name suggests, Prakruta Palita occurs due to the old age and Vaikruta Palita occurs in the younger ages. As per the contemporary sciences, we can justify premature graying hair due to the acute stress induces the loss of melanocytes. Etiologies. Let us discuss about Nidana as per the Sushruta Samhita Nidana Sthana 13 chapter 37 sloka. Shoka, Shrama, Krodha and Ati Sevana are the means Ati Yukta Lavana Sevan by pregnant woman may cause palita in offsprings as per the Charaka Sharira 18 chapter 21 sloka. There are some interesting Pitta Buddhikara Nidana in Sutra Sthana, which is there, which mentioned in the Sushruta Sthana of Krodha Shoka, as per the 21 chapter, 21 sloka, Tila Tela, Pinyaka, Haritaka Shaka, and few varieties of Mamsa, that is Goduma, Aja, and Avika, sheep, and various milk derived products can cause the palithia. Second, as per the contemporary sciences, there are mentioning of lifestyle causes, genetic factors, and environmental factors, such as exposure to the heat and sunlight, using of harsh chemicals, treatments like keratin, smoothing, and various harmful hair products, and also the genetic factors also lead to palithia as per the heredity, and by the pollution exposure to the accelerated harsh chemicals can also lead to the graying of hair. pathogenesis. As per the Bruhataris, Krodha, Shoka, Shrama increases the Vata and Pitta. Intense increase in the Sharira Ushma, which later enters the Shiras and Shiras to cause the Keshapachana. Here are the some references according to Charaka, Chikitsa, Charaka, Sushruta, and Vagbhatta. According to Ashtanga Hridaya, there are some lakshanas. Um, um, hello. Vagbhatta mentions um, Sputika, Ruksha, Kharatva are the some lakshanas of Vata. Daha, Pita Varna are the Pittaja lakshanas. Snigdha, Stulatva, Shukla Varna are the lakshanas of Kapaja, and the Mishrana lakshanas is Sattvaja. So coming to a conclusion, to conclude the paper, I would like to emphasize on the fact that a balanced diet, proper lifestyle, and use of herbal remedies like amlaki, ringarat, brahmi can, and the seasonal panchakarma like vivenchana and the routine dinacharya can avoid the possible occurrence of this condition. Thank you.
Thank you, Rohini. Judges, over to you for the further questions.
Rohini,
Yes, sir.
you're studying in first profession, no?
Yes, sir.
Okay. First of all, I appreciate your effort. Being in first year, you have attempted for the paper presentation in a national seminar. Congratulations.
Thank you, sir.
And you have mentioned classification of palithya, no? I'll ask very simple
Yes.
question. You have mentioned Prakrita and Vaikrita palithya, no?
Yes, sir.
Can you tell the reference for that?
Reference. Wait a minute. So I did not wrote that reference.
Okay, that's fine.
Sorry, sir.
You are being in the first year, it's fine. It is mentioned in Sushruta Samhita, Nidana Sthana, 13th chapter. Even you get a reference from Sharangadhara Samhita also, Kala Janita Palithya and Akala Janita Palithya. Okay?
Yes, sir.
Good
Okay.
work. Keep it up. All the best.
Thank you, sir.
Thank you, Rohini. Thank you, judges. Moving on to the next presentation, the 16th presentation by Sri Hari Vaishnavi from Sharda Ayurveda Medical College and Hospital, Mangaluru. The title of the presentation would be Shastrartha of Khalitya and its Chikitsa, a conceptual interpretation. Over to you, Sri Hari.
Yes, ma'am, is the slide visible?
Yes, Sri Hari, you can start your presentation.
I'm in two accounts, ma'am. One video and one slide. That's okay, ma'am.
Yes, yes. Your voice is
Hello.
also audible and you're presenting also, so you can continue.
Okay, okay. Pleasant good evening to one and all gathered here. I'm Srihari Vaishnavi from Sharada Ayurveda Medical College and Hospital, Mangalore. Today, I'm going to present on the topic Shastrartha of Khalitya and its Chikitsa, a conceptual interpretation, guided by Dr. Priyanka. I have started with the introduction on formation of hair.
based on Ayurveda, and Samprapti of Khalitya, Sadhya and Asadhya. Like I have also told that hair fall can lead into Alomata and it can become Asadhya. And the diagnosis and the factors very much needed for the treatment of Khalitya. And Khalitya as a Pradana and Apradana Vyadi, and the seasonal hair loss, and how Khalitya can be treated, why treatment is first of all important, and how it can be treated. And it has been told in application of Swabhava Uparama Vada. So, in the very beginning, why I've selected this disease, because almost every man and woman at any stage of their lifetime suffer from hair fall. Almost at the age of 50% of the men are bald. And then they reach the age older, the percentage increased to 98. So I have taken this disease, and in the review of literature, we know that before the formation of apara, that is before the birth, in the womb, the nutrition for the child is taken from the mother through upasneha and upasveda method. So after the formation of apara, it is through the apara. So the hair develops in the 6 months according to Charaka, and at the according to Charaka at the 3 months, and according to Ashtanga Hridaya at the 6 months. So after the birth, how this development of or the nourishment or the maintenance of hair happens is the ahara rasa taken by the individual is undergone vibhajana by Jatragni, and it is formed into ahara taken is formed into ahara rasa by the action of Jatragni, and ahara rasa will form into Sara and Kitta Bhaga, and the Sara Bhaga will be nourishing the Uttara Dhatus. Here the Dhatu Agni plays a major importance. We cannot tell only Asti Dhatu is very important. The other Dhatus are also important according to the Nyayas. The Poshaka Meda Dhatu will give rise to Poshya Asti Dhatu, Poshaka Asti Dhatu, and Kesha, that is Mala of the Asti. And the Nidana, according to Trimarmiya Chikitsa Adhyaya, Tejo Anila Dehi, that means the Sharira Ushma along with Anila Dehi, Bahuvachana. So Vata and the other three doshas. This scorches the Kesha Bhumi, that is the scalp, and the person will suffer from Khalitya. Khalitya can be Kalaja and Akalaja. Kalaja is seasonal hair loss, and Akalaja is based on Nidana and Agantuja. Khalitya can, like continuous hair fall can lead to Alomata, and it is a Asadhya Vyadi also. And the discussion and in the discussion part, the diagnosis and the treatment of Khalitya, first of all, we should see whether it is Nija or Agantuja. Agantuja is not just by going and hitting the head somewhere and hair will fall. Not such case. That is also included. But in case of Agantuja, especially, paper has been seen in where Feller and Bloxham Medical Institution, where a woman has been gone with pelvic fracture, a very serious pelvic fracture, and she had a very thick hair during her admission to the hospital. Gradually, the thinning was seen when the fracture was not in cure, and she was completely bald. In case of Nija, Ama, we have to check for the involvement of Ama, or Asti, involvement of only Asti, whether it is a secondary, whether this Khalitya is a secondary disease, and whether Meda involvement is there or Ama plus Meda is there. All these things should be seen, and the Agni also should be seen. So Khalitya is a Pradana and Apradana Vyadi. Khalitya can be a Swatantra Roga, Paratantra Roga, Upadrava, Lakshana, Vyadi Melaka, Nidanataka Roga, or it can be a Purva Rupa. One simple example wherein in cancer treatments, patients are undergoing chemotherapy and radiotherapy, and they are having hair loss. In this case, this can be taken as a Vyadi Sankara or a Vyadi Melaka, wherein the Aparishuddhatva of the Chikitsa, that is the chemotherapy and the radiotherapy, is leading to Khalitya here. So in seasonal hair loss, that is, it is Kalaja hair loss, the usually hair growth will be going into a stage of Shaya in the autumn, that is in the Sharad Ritu, due to the Pitta Prakopa and the Ushma of the sun, which is being taken from the Nidana, basics Nidana. So this is Sannikrishna Nidana. And in the Viprakrishna Nidana, if the person is still more involving in the Adhisevana, Atapasevana, and still Vatarahara, Pittalahara, then there will be Khalitya. Here my main comparison is Swabhava Uparamavata Vada in the treatment of Khalitya. According to Swabhava Uparamavada, Swabhava is nature and Uparama is destruction. By nature, there is a destruction. Though it is a Vaishamya of the Dhatu, or it is a Samatva of the Dhatu, both will undergo destruction at one stage. So let's consider a patient or a person is taking Vishamahetu continuously, and there is Khalitya happening in him, and we have to do Nidana Pariyojana, Shamana, and treat the patient and bring back to the Samyata. If in case the patient is following Hita Ahara, Patya, all these things, dinacharya, rutucharya, ratricharya, everything, and still he is suffering from hair fall, then what is the need of treatment there? Because if he is following still, and at one stage the Vishamata will go into the Satmyata, Samanavastha. So why is the treatment needed? Because we have to speed up the process of going to the Samyavastha. So that is the need for Swabhava Uparama Vata. The treatment is for speeding up the Chikitsa, speeding up the hair growth. And Chikitsa for collagen, acalaja type of khalitya I have been given. In both the thing, first thing, if there is Nidana, we have to do parivarjana of the shodhana is done mainly to remove the excess dosha, and then Kesha Davyas to be given. Dinacharya Ritucharya should be followed properly, and Matravata Ahara.
Srihari, your time is done. So thank you. Judges, over to you for further questions.
Shri Hari Vaishnavi.
Sir, am I audible?
Yes, Shri Hari Vaishnavi, you are audible.
Sir, whether the presentation was audible?
Yes, it was audible, but as the time was exceeded, you've been muted, I think so. For the
No,
last
sir.
slide.
From the first. No. From the first, whether it was audible?
Yeah, from the first, it was completely audible. There is no problem with that.
Okay.
Take a deep breath. Relax. You have done an excellent job. Okay. Shri Hari Vaishnavi, you have mentioned many things, many concepts you have brought to the stage. And in, so you have said khalitya as a lakshana, as a vyadhi, as a upadhrava, as a nidhanartakara, as a vyadhi melaka, vyadhi sankara. And you have quoted as aparishuddhatva in terms of chemotherapy.
Yes, sir.
Okay. Just for a general thing, why in chemotherapy patient tend to lose hair?
In chemotherapy, sir?
Yes.
Sir, let's go in the concept of Ayurveda itself. In chemotherapy, the drugs which are given will increase the pitta in the body. So that pitta will join along with the vata, and ushnata of the body will be increased in the chemotherapy because of the metabolism of the drugs. And this will trigger the pathogenesis, the samprapti which we have seen, tejo, ushma, anila, dehi, and khalitya will be happening.
Okay, it's a what you can narrative review and a hypothesis. Appreciate your effort. It is in a simple phase. It will stop the anagen pacing. That means it cannot differentiate. A chemotherapy agent usually cannot differentiate which is rapidly growing. In our body, there are a number of cells which rapidly grow. One among is our hair follicle. So anagen phase is affected.
Affected is
Okay. So we cannot simply claim it's a aparishuddha chikitsa because it's the effect of dravya itself. Because we said dravya when we use in a yukti utaha, it acts as a amrita. Otherwise, it can act as a fire. It can act as a visha. So it's the adversity of the drug.
Okay.
Appreciation for your good effort. Keep up your good effort. All the best.
Thank you, sir.
Thank you, judges. Thank you, Srihari. Moving on to the next presentation, the 17th presentation by B.K. Sri Kumar from Dhanvantari Ayurveda College Hospital and Research Institute, Siddhapur. The title of the presentation would be Shastriya Vivechana of Khalitya and Palitya. Over to you, Sri Kumar.
Ma'am, I am audible?
Yes, you're audible.
Ma'am, is the PPT showing, ma'am?
Yes, you can start with your presentation.
Okay.
Namaste to each and everyone present here. Myself, B.K. Srikumar. Ayurveda is a science which deals about Manasika as well as Sharika Swasthya. Kesha is considered as the prime factor for a beauty of a person. If there is a good Kesha, the person may feel happy, good and prestigious. If there are some deformity in the hair, it may lead to Manasika Vyadi, further it will lead to Sharika Vyadi and many other problems. Due to many causative factors in present scenario and in present generation, we are facing many problems like early graying of hair, early falling of hair, etc. This can be considered under khalitya and palita according to our Shastras. First, khalitya. Khalitya is Kesha Vikara with the predominance of Vikriti of Pitta dosha. Due to Nidana Sevana like Ati, Tikshna, Ushna, Vidayara in day-to-day life like eating chips, burger, pizza or excessively fried items. Along with Vata, it gets Stansamshra in Romakupa and leads to the falling of hair. It does not stop over there. The Shleshma along with Dushita Rakta will go to Romakupa and force the Chidras of Romakupa and leads to Khalitya. Acharya Sushruta tells Indralupta, Khalitya and Rujya as a synonyms. But Acharya Vagbhata says Indralupta and Khalitya are two different disorders. Acharya Vagbhata says Indralupta is a sudden falling of hair over the head region. Khalitya is gradual falling of hair in the head region. But to the Sushruta's commentary, Acharya Kartika says Indralupta is falling off hair in the region of beard and mustaches, in the face region especially. Khalitya is falling off hair in the head region and Rujja is falling off hair all over the body. These are the same things in modern science they explains alopecia and its types. Acharya Vagbhata further divides Khalitya into 4 types based on doshas, that is Vataja, Pittaja, Kaphaja and Sannipataja. Next, if we go move on to Palitya, Palitya is Keshapakha. Kesha is gets Paka. That's what is discoloration or discoloration of Kesha is called as Khalitya. Palitya. The Nidanas like Krodha, Shoka, Shrama, etc. will lead to Shariroshmata because Manasika and Shira doshas are interrelated. The Rajas may increase Pitta in the body. And also, due to Pitta Vardhaka Ahara, whereas in case of Pitta, Shariroshmata will be increased. That is, Pitta will be increased and it will get Ashraya in Shiras and thus the Paka of Kesha and leads to Palitya. Acharya Vagbhata classifies Palitya into 4 types based on doshas, that is Vataja, Pittaja, Kaphaja and Sannipataja. Acharya Charaka in the Chikitsa Sthana, Trivarni Adhyaya Chikitsa, he explains the correlations between Palitya and Khalitya. He says, Pragupita Pitta, when does Atyanpadagata in the Kesha, it will lead to Harita Kesha. When it does Alpadagata, it leads to Palitya Roga. And Atyadagata will lead to Khalitya. In the other scenario, Acharya explains Asti Dhatu Mara as Kesha. So, for the formation of each and every Dhatu, Rasadhatu plays important role. If there is any deformity in the Rasadhatus, also will lead to the Dushana of Kesha. Next, Sadhya of Khalitya and Pahitya. In Ashtanga Hridaya, Uttara Tantra 23rd chapter, they explains Asadhya Sannipadena Kalita Palitanisha. Sannipadasha, Khalitya and Palitya Asadhya. Next, if we come to Chikitsa Siddhanta, Nidana Parivarshanameva Chikitsa, as told by our Acharyas. And Acharyas also says that Ati Lavana, Ati Pippali Sevana, Ati Kshara Sevana will lead to Khalitya and Palitya. And avoiding these things and also Pitta Vardhakara Viharas will help in preventing Khalitya and Palitya. Then if we come to Shodhana, Acharya Sushruta and Vagbhata says, after Snena and Svedana, Rakta Mokshana, especially Siraveda should be done. According to Acharya Charaka, after Romana and Vimana, Virechana, Nasya should be given. For Nasya, Vidargadaya Taila, Anutaila can be used. For Lepanartha, according to Acharya Sushruta, Kasisa, Manashila, Tutta, and Varisha Lepa can be done. Hastidanta Masi is told for Hidrupta, by Acharya Vagbhata, but present day it may be impractical. For Abhyanga, Prapunda Kaitela can be used. As I told before, Rasadhatu Dushti will be there in the Kesha Vikara. For Rasayana Artha, Rasadi Dhatu, Uttama Artha, Kuti Praveshika Rasayana and Vatatika Rasayana can be given. For Kuti Praveshika Rasayana, Brahma Rasayana can be given, Chandrakasha can be given. For Vatatika Rasayana, Susan Shaichuna, Narsimha Taila can be given. Patya Harat Viharat, which does the Shamana of Pitta should be done. Manasika Patyas like Akrodha, Indra Nigra, Satya, Adhyatma Parayana should be maintained. For concluding the presentation, there is no roga without the involvement of sharir, manas. So mana nigra should be done for this rogas also. By following Dinacharya, Ritucharya and Acharya told by our acharyas, we will not get these diseases. If we get these diseases also, it can be cured through Ayurveda only. Thank you.
Thank you, Sri Kumar. Judges, over to you for further questions.
Sri Kumar Hegde, isn't it?
Yes, sir.
Okay.
Yes, sir.
I have compiled very good notes, like I have referred the Samhita, you have referred even the Tikas, and you have made a very good compilation. Congratulations to you.
Thank you, sir.
And in the beginning, very interestingly, you have claimed when you said Nidana, consumption of burger and pizza, isn't it?
Yes, sir.
Can you justify that point?
Sir. It will increase the pitta in the mashali. Vidahi guna it has.
Okay. Whether pizza and burger literally leads to khalitya and palitya. That means whether it leads to graying and falling of hair.
Sir, no. It leads to pitta vardhana. If pitta gets samshaya in Kesha Pradesha, sana samshaya, it may lead to khalitya and palitya.
Okay. So when we claim, because in a national platform, when you claim, we should be very cautious also, because these are foods. Okay. Though they are, we can say they are food, but still they are junk. Why they are called junk?
They cause harm to the sharir.
Okay. Junk in the sense they are rich in calories, but they are poor in nutrition. Isn't it? So they are lack with the essential nutrients, maybe a biotin or maybe the iron or zinc that may be lacking in it. And so which is essential for our hair. At the same time, they are very high in calorie, high glycemic index. And whenever there is a high glycemic index, that over the period, not just 1 or 2 consumption, but if it is a satatya seva, or we always say, then it ahara. So there could be insulin resistance, and that is being linked with the androgenic alopecia. So what you claimed is correct. What you said is correct. What was lacking is a bit deeper understanding. I hope in future you will incorporate that also. All the best.
Yes. Thank you.
Thank you, judges. Thank you, Sri Kumar. The next presentation, the 18th one, would be by Naveen Rahul J. from Sri Raghavendra Ayurveda Medical College and Hospital, Chitradurga. And the title of the presentation would be Role of Haridra Karkuma Longa in the Prevention of Tvak Vikara. Over to you, Rahul.
Ma'am, can I audible, ma'am? Am I audible?
Yes, you can start your presentation.
Namaste. I am Naveen Rahul, just studying second professional BMS in Sri Raghavendra Ayurveda Medical College and Hospitals, Maladihalli, under the valuable guidance of Dr. Niranjan Prabhu BG, Associated Professor, Department of Dravya Guna. My topic is Haridra in the prevention of Tvak Vikara. Let's start my presentation. Introduction. Ayurveda provides a comprehensive care in all aspects of life. In that, Haridra, Curcuma longa, belongs to Gingiberaceae family, is useful not only due to its medicinal property, but also it's useful in culinary and religious purpose. Turmeric is one of the first known cosmetics traditionally discovered by women. As they apply on their skin, they believe that it reduces the facial hair growth, acne, and improves the complexion. Let's see the objectives. To understand the cosmetic potentiality of Haridra, and to establish the role of haridra in the prevention of throat vikaras by investigating the antifungal, anti-inflammatory, antioxidant properties, and to investigate the role of haridra in the reducing the incidence and the severity of various throat vikaras. Let's see the methodology. A review about haridra will be made from the following classical literatures that are like Samhitas like Sirak Samhita, Shushruta Samhita, Ashtangarudaya, and Nigantus like Dhanvantari Nigantu, Raja Nigantu, and Bhava Prakash Nigantu. And research update regarding Haridra is Kurkumalanga is also referred. In the observation. In the observation, I have made as follows the Rasa Panchaka of Haridra. The Rasa Panchaka as follows. Rasa is Tikta Katu Rasa, Guna is Ruksha and Lagu Guna, and Vipaka is Katu, and Ushna Virya. The active principles of Haridra is like curcumin, curcuminoids, methoxycurcumin, dimethoxycurcumin, methoxycurcumin, and volatiles. The properties exhibited by Haridras are antifungal, photoprotective property, anti-allergic property, anti-inflammatory property, and anti-cancerous property, and antioxidant. Let's see how it helps in Twak Vikaras. Antifungal property. Turmeric oil, it is also great fungicidal action that cures the infection caused by Aspergillus flares, parasiticus, and Penicillium digitorum. Let's see the photoprotective property. This action is due to the antioxidant activity. Large part of lipid on the surface of the skin is unsaturated and it is easily attacked by the free radicals. The virus of the skin is easily penetrate the skin and causes the damages. The study shows that curcumin, that the extract of the haridra, was shown effective in suppressing the inflammation and protecting the epidermal cells, and also it blocked the gamma radiation from the UV. Let's see the anti-allergic actions. This property is mainly dependent on the antioxidant property. Here, the glycoside of the curcumin works in an allergic reaction by inhibiting the release of histamines and inhibiting the non-specific and specific mast cell-dependent allergic reactions. The anti-inflammation property. The anti-inflammation property is curcumin is a potent anti-inflammatory property in the specific lipogenase and COX2 inhibiting properties. It's effective in decreasing the both acute and chronic the inflammations. Anti-cancerous property. This is a more potent while curing the anti-cancerous. Some of the research are still going on this. Let's see the wound healing property. It promotes the healing and prevents the scarring in acute injuries like burn, and by inhibiting the phosphorylase kinase and subsequent NF, KB, bar TGF beta signaling pathways. Let's see the anti-aging property. Anti-aging of skin. The Erythra is the best anti-aging of skin, and the curcum longa, its essential oils are determined by performing the blocking UVB radiation induced skin aging and also reduces the thickness of the epidermis. In Masurica, it also correlated as chicken pox. It is the piece of Erythra and tamarind leaves taken with the cold water and applied to the affected areas. It will cure the chickenpox or Masurica. In Visarpam, Haridra plus Moola of Bringaraja in equal part, pounded with cold water, and the paste is applied. In Slipada and Dadrukustam, the Haridra and Gomutra plus Guda Jagri is that applied to the affected area. It will cure the Dadrukustam. By this, I will conclude my topic that thus the assessing with the Rasa Panchaka of Haridra, the associated with traditional and medicinal benefits, we can consider Haridra as not only helpful in curing the Twak Vikaras, but also a potential drug for prevention of Twak Vikaras. Also, it is helpful in maintenance of the skin and health, and Haridra can be also taken internally and externally. These are my references. Thank you.
Thank you, Naveen Rahul. Judges, over to you for further questions.
Naveen?
Yes, sir.
Very good presentation. Can you display your first slide?
So, first slide. Yes, sir.
Previous title slide, please.
Yes, sir.
Okay. So, minor correction. It is not associated professor. It is associate professor. Okay.
Okay, sir. Okay, sir.
Because it's a designation, it should be correct, right?
Okay.
And you have mentioned all the benefits of Haridra, right?
Yes, sir.
And it's how it could be beneficial with the biochemical multiple pathways you have mentioned.
Yes, sir.
In it. But is there
Yes,
any adverse effect by
yes,
it?
sir.
Hmm.
Is an adverse effect. It causes a diarrhea and it increases the body heat, and also it causes the minor stainings in the body, and also it increases the blood sugar content in the body, sir.
Okay. So
Yes,
when we use excessively, there is a skin staining, no? You have
yes,
mentioned.
sir. Yes, sir.
So whether that will be any problematic?
Sir, not problematic, but to the in beauty purpose, somewhat the awkward feeling like that.
Okay. So whether it is like, can anyone tolerate this haridra, or is there any possibility of sensitivity?
Sir, most probably the diabetes mellitus people may should not take, I think, because it increases the blood sugar content.
It doesn't directly lead to blood sugar content. Okay, that's fine. But whenever we say any claim we have to make, right? Which it should be
Yes,
made
sir.
sure that it is not sensitive to an individual. Any.
Okay, sir.
So
Yes,
we
sir.
always go for a trial application, and then it should be made into generalized. Any.
Okay, sir.
But always we have to keep in mind that sensitive for an individual, because we cannot predict whoever
Yes, sir.
sensitive to which drug. Otherwise, definitely it is a wonderful drug, and it has a heavy potential to cure most of the conditions. Thank you for your presentation.
Thank you, sir.
Naveen,
Sir,
Naveen, haven't you find antitoxic activity of the haridra? Because most of in Kushta rogas, the Dushi Visha is having a main role. Then haridra can be used as a antitoxic agent.
yes, sir. In
Uh,
our
because,
sir, in our Ayurveda, they mentioned about the Vishagna property of Haridra, sir.
yes, but you have not mentioned throughout your slides, no? I haven't seen.
Yes, yes, sir. I have mentioned in the observation the karma of Haridra.
Hmm. And most of the doshi visha that in contaminated food like pesticides and insecticides, we can use the haridra to reduce the level of pesticides and insecticides in the food. We have to soak the vegetables and fruits in haridra jala for 10 minutes. It will reduce the level of pesticides and insecticides. That helps to prevent so many diseases. That also you can mention in this.
Okay, sir. I will. I will, sir.
Okay. And you have mentioned that haridra is not good for diabetes
Sir,
mellitus. No?
it may causes the blood sugar increase in the blood sugar level, sir.
Okay, you have. I think it has taken from article, no?
Yes, I
What is the
referred in some.
reference?
Sir, that I referred from the Google, sir. My other are from articles, sir. It,
That's right.
that,
Because we are using the Nisha Amaleki yoga to control blood sugar. That is contain the Haridra.
yes, sir.
Haridra and Amaleki is a uh,
So,
main drug we are
in
using
excess
for the management
consumption,
of.
it may causes. So, in excess consumption of Haridra may causes increase the blood sugar levels, sir.
Yeah. That may be we have to reconsider. Okay, thank you very much for your nice
Thank you, sir.
presentation.
Thank you, judges. Thank you, Naveen. Moving on to our
Yes, sir.
last presentation of the day, the 19th presentation by Tarun Kumar US from Sri Raghavendra Ayurveda Medical College and Hospital, Malladdihalli. The title of the presentation would be Nidana Panchaka of Kushta. Over to you, Tarun Kumar.
Ma'am, am I audible?
Yes, you're audible. You can start sharing the screen. Yeah.
Wait, ma'am. Whether the PPT is on the screen?
Yes, the presentation is on the screen. You can start presenting.
Okay, thank you. Shubhayu, Namaste everyone. Myself, Tarun Kumar from Sri Raghavendra Ayurveda Medical College and Hospital, Maladi, studying in second profession BMS under the guidance of Dr. Sinjana ma'am, Associate Professor, Department of Roga Nidana. I am presenting you the topic Nidana Panchaka of Kushta. In recent years, Tokvikara are common and frequent due to various reasons like unhygienic environmental conditions, poor sanitization, improper skin care, and food style, etc. Uh, Here, Pushpa, we are discussing, as it is one among the Ashtamahagata, it comes under the group of skin disorders with diverse manifestation. The Nidana Panchaka framework offers a comprehensive tool for understanding the web of causative factors underlying the diseases. And the Nidana Panchaka are Nidana, that is predisposing factors, or the etiology, and the Purva Rupa, that is prodromal symptoms, and the Rupa, that's the manifestation, and the Upashaya and Samprapti and pathogens and the Upadravas, like complications. And here comes the Nidana. First, we are discussing the Ahara Nidana, like consumption of Viruddha Ahara, excessive Drava, Snigdha, Guru Ahara, excessive intake of Navana Dali or Matsya, Amla Rasa, Pradhana Aharas, and Masha Mulaka, Tila, Kshira Guda. Actually, consumption of these Ahara will lead to the production of toxins, that is Ama, and that will lead to provoke an vitiation of the all the doshas, and there it will get mixed with the digestive juice and then rasadhatu, and so on. It spread from one dhatu to next dhatu. So dosha spreads from kosha to shaka while traveling. Wherever there will be a kai vaigunya, then there it lodges and it shows the symptoms. And coming to the viharaja nidanas like vega dharana, especially the charji vega and the achi vyayama, shitoshna langanahara, ajirna adhyashana or and divasapna and panchakarma apacharin, vyayamacha apyajirne anna. And the manasika and others nidanas are like uh, manasika nidanas like baya, krodha, shoka, and the other nidanas like purva janma papa karma and vipran gurun garsha utpatan. And the coming to the purva rupa, Atis Lakshana, it is due to the Guru and Snigdha Guna. Atikara Sparsha, it is due to the Ruksha Guna and Vata Prakopa. Vaivaranata, according to the dosha involvement, there will be layers to different color. And Atisveda or Asveda, it will leads to due to Roma Kupa and Chitta Dosha Dushti. Daha, that is due to the Ushna and Tishna Guna. Kandu, that is due to Snigdha and Guru Guna, which is the Kapha Pradhana, and the formation of Rana, that is blisters and Shula with pain. And there will be horripilation of the hairs, that is Roma Harsha. And coming to the Rupa, Lakshana of Roga will appear on the fifth stage of the Kriya Kala, that is Vekta stage. Here, there will be a discoloration of the skin will take place. For example, in Kitiva Kushta, Shava Varna will expose as a Rupa because of the Vata dosha. And Karatoma, that is due to also Vata dosha. And Karkasha Sparsha will be there. Uh, Then Parushama, that is due to of Rukshat of the Twacha, and Krishna Varna and Aruna Varna of Vata, and Shrava, that is due to Pitta, and Ugrakandu will be there. That is due to because of the predominance of Kapha dosha, and there will be Vriddhi, there will be increase in the size of the lesions, or there will be Guru or Dura or Gana, and that will indicate the thickness of the Pranasthana. Coming to the Samprapti, repeated acceptance of Nidana, that will lead to the Tridosha aggravation, and that leads to the Shaitilya of the body composition, that is laxity in the bodily components. That will lead to the aggravation of the Vata dosha, that carries the Pitta dosha and Kapha dosha within it, and there will be onset of first symptoms. Even though onset of first symptoms, even if we consume the Nidana, there will lead to the Saptadravya Sangraha, that will lead to the involvement of the uh, Saptadravya Sangraha, means the other body compositions, and that leads to the movement of vitiated dosha towards the throat, and that leads to the Kushta. Coming to the point, Saptaka Dravya Sangraha, due to continual acceptance of causes, Vata Pitta Kapha doshas will vitiate with all their qualities. This vitiation is associated with the weakness of dosha. Primarily, in Saptaka Dravya Sangraha, there will be involvement of four dhatus and three doshas. The four dhatus mainly Twacha dhatu, and that is Rasa dhatu, Lasika, Rakta, Mamsa, that will take part. And these four elements and the three doshas make seven essential components of the Kushta Samprapti, that is Saptako Dravya Sangraha. And here are the Upadravas, that is complications: Shosha, Ayasa, Supti, Bedavangana, Daha, Sweda, Kandu, Utseda, and Krimayastu. And here are the classification of the kushta. Mainly, it is divided into mahakushta and shudra kushta. In mahakushta, sub-classifications are kapala kushta, audumvara kushta, mandala kushta, rishayajma kushta, pundarika kushta, sidma kushta, kakanaka kushta. Coming to the shudra kushta, it is sub-classifications are eka kushta, charmakya, kitiba, vipadika, alasaka, pama, shataru, vispota, dadru, charmadala, and vicharsika. So Samprapti Ghataka of the Kushta disease is the dosha involved are Tridosha, that is Vata, Pitta, Kapha, and the doshas. Primarily, there will involvement of the four dhatus, that is Rasa, Rakta, Mamsa, Lasika. Later, there will be involvement of the Sapta dhatus. And the Srotas, involved are Rasavaha Srotas, Raktavaha Srotas, and Mamsavaha Srotas, and Swedavaha Srotas. The Adhisthana of the Kushta will occur in Tok. And this Srota Dishti is due to Srota Dishti is caused by Ati Pravritti and Vimarga Gamana. So the Swabhava of the Kushta disease is Shirakari, and the Agni Dishti happens here are Jataragni and Agni of all the seven dhatus. So here comes to conclusion. Kushta is a Tridosha Chalna Vyadhi. Therefore, first predominant dosha should be treated, and then Anubandha doshas to be treated. It is considered as one of the most chronic diseases in the body.
Tarun, your time is up. So thank you. Over to the judges for further questions to Tarun.
Tarun? Tarun, are you there?
Tarun, you can unmute your mic.
Yes, sir.
Okay.
Am I audible?
Yeah, definitely you're audible. Okay. So my basic question is like you have taken a very big topic like Nidana Panchaka of Kushta.
Yes, sir.
And putting that into a 6-minute presentation is at most difficult.
Yes, sir.
So if you want to put forward 2 sentences that this is my gist of the presentation, what that would be?
So, sir, here understanding the Nidana Panchaka of Kushta is very important to develop the targeted therapeutic approach or the specification of the doshas involved in the kushta. So Nidana Panchaka would be the main uh, tool source.
Okay. Very interestingly, it is said regarding the nidhana, the karma is also being explained,
Yes, sir.
isn't it? So,
Yes, sir.
in that regard, how to assess the effect of karma?
I will reference.
So, that is the one of the very interesting aspect regarding the kushta, where they have mentioned the papa karmam kurvatarasthatha. So they
Yes, sir.
have mentioned the karma is the
Yes, sir.
effect that to iha janmakrata or maybe the puru janmakrata karma.
Yes, sir.
And
Yes, sir.
so when it comes to the treatment aspect, when you suspect, whenever there is a etiology is very minimum and the effect of the valley is huge, or whenever we find a serious ailment without the presence of the etiology, then we have to assess the karma. That is how karmaja, dosha karmaja, and valley classification is being made, and that is the criteria we have to follow even in the case of kushta. Okay,
Yes, sir.
that is why the treatment protocol we may have to incorporate not just the Daiva Upashraya, Sattva Upashraya, sorry, not Etiopathogenesis, Sattva Vajaya, even Daiva Upashraya Chikitsa also being highlighted.
Yes, sir. That is like
Okay.
mantra Aushadha Mani.
Yes, right?
Yes, sir.
Otherwise, it's a very valiant effect. Tarun Kumar, keep it up.
Yes. Thank you, sir.
Thank you, Tarun. Thank you, judges. So we have come towards the end of today's session. It's been a blend of knowledge and understanding. So primarily, let me congratulate all the 19 participants for your dedicated presentations. It's time to hear to the judges for their inputs about the session. So over to Dr. Arun sir. Please share your inputs, sir.
I think out of 19, 8 are remaining, including we two judges and obviously the moderator. So I know it's very a lengthy and hectic session for most of them. William Arthur said, like great teachers inspires. So first and foremost, I would like to thank all the teachers, those who have molded these young minds for this kind of presentation. So big kudos to all the teachers who have prepared the energetic students into this wonderful platform. And obviously, I must appreciate the dedication and effort made by each and everyone. It is not that simple to present the content in a very short span of time. This requires a lot of effort. So once again, congratulations to all the participants. And just I want to say to our budding fellows that we have to push the boundaries. It is not only for the betterment of our Ayurvedic field, but it is also for the society. So once again, congratulations and may your journey of learning continue to shine brightly. All the best. At the outset, I'd like to thank the organizers who had given this wonderful opportunity where I could be a part of this wonderful knowledge sharing platform. So thanks, kudos to the organizers, and also I wish the organizers a grand success on the national seminar Punarvasu. Thank you.
Thank you, Dr. Arun sir, for your valuable and encouraging inputs. Now I request Dr. K. Manaram Pereira sir to share his inputs. Please, mic ahead. Pereira sir, am I audible to you? ಡಿವೈಸು ಮ್ಯೂಟ್ ಅಲ್ಲಿದೆ ಅದನ್ನ ಹೇಳೋಣ ಅದು ಮ್ಯೂಟ್ ಅಲ್ಲಿದೆ.
Hello, am I audible?
Yes, sir, it's audible.
I would like to congratulate all presenters because as undergraduate students, they presented very well because we have to appreciate their efforts. Um, and in the same presentations, there were some things I have to tell them. There are some presentations. In the presentations, the slides are very congested with so many things. As undergraduate students, you have to learn in a presentation. You have to include important things and very you have to describe those things in your presentations. Don't put all the things in the slide. And other thing is when we do a presentation in a scientific session, we don't want to do the same concepts and things. We have to we don't expect the concepts in the presentations. We want more discussions. You have to discuss about the concept, not only the concept in your presentations. At the discussion, what you have observed and what we have learned from this literature research, that you have to present in the presentations. And most of the students, they have focused on kushta rogas. Actually, when we consider the clinical practice in cosmetology, most of cases come to cosmetic clinics are described under the Shudra Rogas. No one from the 19 presentations have discussed, focused on Shudra Rogas. That we have to, because in the treatment of cosmetology, we don't want to go for a treatments like kushta, because it is a we have to do shodhana and all the things in the kushta treatments. But for some for example, for acne vulgaris, like those things, we have to treat according to the shudra rogas. Therefore, we have to in the cosmetology, we have to more focus on Shudra Rogas. That is my idea. And I have to thank the organizers, the APTAs, for organizing such an event. And thank you for inviting me as a judge. And thank you all presenters and Dr. Arun sir for his valuable comments on the presentations. Thank you very much for inviting me. Okay, thank you.
Thank you, Dr. Pereira, sir. Those were most valuable inputs. Last but not the least, handing over the session to the coordinator, Dr. Kiran, sir, for the vote of thanks.
So, good evening, everyone. So, we have come to the end of today's session. At this juncture, I would like to wholeheartedly thank our judges for today's session, Dr. Arun Kumar, sir, and Dr. Manaram Pereira, sir, for being with us and supporting us with their valuable time and judgment, and also enlightening us with their knowledge and valuable inputs. Thank you so much, both of you. I thank all the presenters for their active participation and good presentations. Thank you all. I thank the moderator of today's session, Dr. Sneha Sishekar, for hosting the event in a very good manner. Thank you, Dr. Sneha. Finally, I thank all who have supported for the event and all the members of Aptas Ayurveda Trust for the background work. Hereby, we are concluding the session. Shubharatri, Shubhayu. Thank you.
Thank you.
Thank you.